Now we talked about eczema before and how the psoralen could cause it. Well, let's look at some other things here. Food, nutrition, diet therapy by Krause and Huncher. And here it talks about how B6, you can give B6 and get rid of problems with fatty acids. So it may not be a fatty acid issue, a lack of it, but a problem metabolizing it, which is the job of vitamin B6. You have to be very aware of that. Now here is a child, and you can see the skin here, how problematic it looks. See all that? So really heavy eczema, and then it's cleared up just months later by giving pure lard. They viewed it as linoleic acid. And so basically, if I have somebody with eczema, I'm going to tell them to get off the furocoumarins, which can cause it, and take maybe a tablespoon of lard a day. And we cleared up many cases of eczema just by doing that. Okay, now we are looking at a couple of different things that will help different organs. So, for example, carrot juice, fresh carrot juice and juniper berries are really good for kidney issues. For the liver, everybody knows about milk thistle, but black cherry juice and dandelion are great. Dandelion is the most used herb in the world for liver issues. Black cherry juice really helps to purge the liver. Adrenal glands, sarsaparilla, Mexican wild yam, red raspberry tea. Most people know about Mexican wild yam for hormones, but actually sarsaparilla was used before that. You can get sarsaparilla extract, for example, from the liquid herbs part of the herb shop, or the vitamin shop rather. Black cherry juice you can usually find at Whole Foods. Red raspberry tea, in the last 3 weeks of pregnancy, women have a surge of progesterone, and so I tell them to go and get some red raspberry tea, which you can get at most any grocery store, and drink a cup in the morning, cup in the evening, and it really helps to have a lot easier delivery. Pancreas, inflammation, chlorophyll, which we just went over in my diabetes essay. And stones after removal of the gallbladder. Pancreatic stones basically occur mostly in people who've had their gallbladder out. So we'll show you how to pass gallstones, pancreatic stones, kidney stones in part 1, so don't miss that. Lungs, comfrey for bleeding, so comfrey tea is very specific for bleeding of the lungs. Tonsils, basically just take a toothbrush and just take it back and just brush real hard the tonsils, and that will help them spit out any pus or old dried pus out of them, and gargle with apple cider vinegar or maybe a 50-50 solution of cider vinegar and distilled water. Thymus produces antibodies, and so basically the autoimmune disorders which we talked about with the leaky gut syndrome. Pituitary, master gland controlled by the hypothalamus, which is nervous system, so don't miss part 1 for that. And part 3, overweight. We went over that earlier. Enzymes. Basically, enzymes, we were taught, are denatured between 128 and 132 degrees Fahrenheit. That's inaccurate, though. It's over about 140 degrees Fahrenheit. So basically, instead of frying or high heating foods, most boil them to try and retain the enzymes. Get as much raw as you can. Fiber, eat the peel and seeds. Trace minerals and antioxidants are mainly found in the peel and the seeds. Now, we already talked about gallstones and how vitamin C metabolism can help exit those out. Well, we didn't talk about how they could exit them out, but basically we show you how to manipulate them in part 1. However, when you have large stones that you can't pass, make sure your vitamin C metabolism, as we talked about before, is normal, because they will help dissolve the gallstones that haven't crystallized with calcium yet. And so the vitamin E metabolism, the acid-alkaline balance, is very, very important for that. Osteoporosis is loss of connective tissue or punched out lesions in mineral stores. Of course, you need vitamin D for the absorption, and we went over that, and vitamin C for connective tissues, copper for the cross links, boron, calcium, magnesium. Avoid milk. Milk is, which we're going to hit here in a minute, is very high in phosphorus, and you actually lose your mineral deposits out of the bone when you drink milk. Phytates, which we talked about, blocks the absorption of the minerals, as does tannic acid and caffeine. High phosphorus diet, which you basically get in high animal protein, cooked animal protein, and grains. Moderate resistance exercise really helps. Let's take a look at a couple of the things with calcium here. 5A, here we talked about pathological calcification. You take too much of vitamin D, especially vitamin D2, can cause calcification of any of your internal organs. Vitamin D and bone. Here's the Lancet. So does vitamin D taking the supplement really help? Systematic review and meta-analysis. Only one study showed benefit, and 2 of them showed detriment. So taking vitamin D supplements, as it were, really does not help with bone density at all. Okay, 7I. Here is milk consumption during teenage years and risk of hip fractures in older adults. Each additional glass of milk per day during teenage years was associated with a significant 9% higher risk fracture in men. So milk isn't that great to help prevent hip fractures. So what about women? 7J. Milk intake risk of mortality and fractures in women and men. High milk intake was associated with higher mortality in one cohort of women, in another men, and higher fracture incidence in women. So milk really does not help hip fractures at all. So here we have 7K. This is Biological Transmutations by Louis Kervran. And here we have a, they did a study with rats, and they broke their thigh bones. So if we go across the upper part, that's one rat. The lower part, that's another rat. The lower part, the rat was given horsetail grass. And here it remained fractured. Here it healed like 4 to 5 times quicker. So anytime I get anybody with fractures or with osteopenia, osteoporosis, I always give them horsetail, because it helps rapidly to help with those situations. Now here's the gentleman 7L, he came into me with, he had a blood test in 2004 in May. He came to me a year afterwards. He didn't do anything that they told him. He said, you know, can you help me? Now, he had 2 or 3 pathological fractures, spontaneous compression fractures in the thoracic area. And at best, with medicine, you get about a 1% per year increase in bone density, no matter what they do. So he had osteopenia at the total hip and femoral neck. And so in a comparison, after a year of doing what I told him, and keep in mind he did nothing for the first year, so he hit me halfway through, 4.5% improvement in lumbar, 6.9, which is 7% increase in improvement at the femoral neck. So we got a 7% improvement just in a year in doing that. So anyway, we can help just quite a bit that ways. Okay, 7M has, and 7N has more on milk and osteoporosis. 7O has a lot of documentation on excessive calcium supplementation, of all things, causes osteoporosis. So there's a lot of that stuff on there for your reading potential. Heavy metals, remove those with chelates, or you can use the flavonoids, bioflavonoids that you find in peels and green leafy vegetables, as we talked about before. Mastitis, you can clear that out pretty quickly taking the type of colloidal silver that I recommend, and email me for that. There's only one type of colloidal silver that I recommend, drBBRK@hotmail.com. I will send that to you. And so you have mothers with mastitis. For example, my wife had it and her breast swelled up. So we had her take the colloidal silver internally, a tablespoon per day for 5 days, and put it directly on her breast. In 3 or 4 days, all the mastitis was gone, so the infection was gone. Seasonal fatigue syndrome. So you have people who are reacting to pollen, for example. Usually you can get people to quit reacting to the pollen simply by avoiding milk products and wheat products, and maybe eggs. And just tell them when the season starts, just make sure they avoid it. And I've had people sail right through it. The majority of people sail right through it just by doing that, with doing nothing else. Sinusitis. Now, we talked about relative to the neti pot, but what about, okay, you keep on having it. One of the things we found out about that is avoid blowing the nose in the shower, and it will stop. And consequently, one of the reasons that we found that out was an MD told me that a lot of people that have the fungus, toenail fungus and toe fungus, is from men blowing their nose in the shower and the women stepping in it and the men stepping in it. So we just told them stop doing that, and it stopped with the occurrence of nail and toe fungus, athlete's foot, etc. But side by side, we noticed that when the men stopped blowing their nose in the shower, their sinusitis stopped. So there's some connection right in there. Chronic vaginal infections. I got this from a family osteopath when I was growing up. Said that women get that because they're taking baths and you got soapy water flowing in and out of the vagina, which is, the soap is alkaline, too alkaline, so the body flushes a whole lot of acid in there, and then they get some fungal infections, yeast infections. he basically started telling women, knowing this, to avoid taking tub baths, and they stopped having vaginal infections. So that's a way to avoid it. Recurrent inner ear infections. So when I'm at seminars, I usually try and sit next to somebody that I don't know at all. And eventually I ask them, what do you know that isn't generally known that you've observed in practice? And everybody has those things. Well, I was sitting in an acupuncture course in, I believe, Kansas City, next to a pediatrician. And he said, oh, that's easy. I can get rid of any inner ear infection in any young child without ever putting tubes in their ears, just by having them avoid milk products. And I found that that is very true. So to avoid having inner ear infections in your young people, get off of milk. Gum infections. I had a woman come to me. She was really scared. I think it's 7-year-old daughter, if I'm remembering the age right. This one, I was in a little town in Oklahoma. Her daughter had severe infection of her gums, and they had tried giving her all sorts of antibiotics. The next thing they wanted to do was split her gums open and scrape them. And I said, well, bring her over. And I had her go like this with the gums, and there was green pus oozing out from between the gums and the teeth. It was gross and it smelled awful. So I had her go to the health food store on the corner and get some extract of lobelia, and which is an expectorant. And I thought, well, this has a lot of healing powers, plus it expectorates things out. And I said, just have her drip that in there 4 or 5 times a day and rub it into her gums with her tongue. 3 or 4 days, she had had these gum infections for years, and it was gone in 3 or 4 days, and it was quite amazing. So that's one way to do that. Warts. Make a vitamin C paste, cover with Band-Aid. Virus. If it's a virus, lemon juice is lethal to all viruses. So drip lemon juice on it and it'll turn black and just fall out. If it's neurological, we address that in part 1. And if it's from dry skin, you put glycerin on it. Just go down to CVS Pharmacy, and in the makeup section they have liquid glycerin. Or you can have a fleet enema glycerin. Just poke a hole in the end of it and squeeze it on there, maybe with a little distilled water beforehand. Cover it with a Band-Aid and just leave it on there, and it'll fall off in about 3 or 4 days. So there are about 3 or 4 different types of warts, and you got to figure it out with that. Jock itch. I've tried all sorts of things with jock itch, but the best thing is just make sure it's clean and dry. Just coat it with Vaseline. It's a result of rubbing on there, and it'll go away just pretty quickly doing that. Essential oils. Linoleic acid. After 40, some cannot convert it to gamma-linolenic acid and arachidonic acid. It's found in large amounts in evening primrose oil and borage seed. Essential amino acids, 10 in children, 8 in adults. Paradoxical acidosis occurs in kidneys because of alkalosis. And basically you have somebody that's on a high alkaline diet, and they're taking antihistamines, and they can their system actually is too alkaline, and it's impairing the function of the kidneys, a primary thing of which is to throw off excess acids. So you will get a more acid urine. They're having trouble breathing. And so you got to watch out if you put somebody on a high alkaline diet, if they're taking antihistamines, that doesn't work too good. Acetaldehyde is a byproduct of Candida infection, and it's absorbed by activated charcoal. So I was on a a nationally syndicated show for a year as a guest doctor. And it was a 3-hour show, and I don't think the guy realized that I listened to the whole show. He had me on the first 5 minutes of the 3 hours, of the middle 3 hours, so the second hour at start. And he said, you know, call me up the day before and we'll talk about what you're going to talk about. So I did. And he didn't know that I was listening to the whole show, and so people would call in and ask him, you know, how good is Dr. Bonebreak? And he said, oh, he's maybe a third runger out of 10. And so I thought, okay, I got to make this a little more difficult. So I started getting more and more difficult, and he started giving me a 5 or 6, and then a 7 or 8. And I said, okay, I'm going to start putting stuff out there that I know that he would not know anything about. And so I got up to a 10 out of 10. And it got so interesting for him that instead of 5 minutes, he was talking with me 15 to 20 minutes because he didn't know about things that I was talking about, and I could always back it up out of the literature. So after a year and having to phone in from wherever I was in the country, I'd had enough of it, and I said, okay, I'm going to stop. So on the very last show, and his show was all about systemic candidiasis, and I posited to him, well, he asked me whether, we've never talked about what you do for candida. So he asked me, what do you do about systemic candidiasis? And I said, well, I don't do anything the same way that you do. And he says, well, what do you mean? I said, well, Dr. Crook basically keeps people off carbohydrates, so he puts them on high acidic diet because the candida thrives on sugars. And he said, yeah. I said, well, I take the opposite tack because candida is a fungus and it thrives in an acidic environment. So I take them off the acid-forming foods, which are in the main grains and cooked animal protein, acidy, tart, sour foods, foods hot that taste without being heated, cranberries, plums, and prunes. And so I put them on high alkaline diet while I take them off of that to make the environment unpleasing. And he puts people on an herbal purge, and so I don't put them on an herbal purge because the body just processes it back in, and the reason for the purge is to get rid of the acetaldehyde out of the system, which is the metabolic poison put out by the candida to weaken the host. So I give them activated charcoal to absorb it and carry it out of the system. And then he puts them on capric or caprylic acid to strip the shell off, which I agree with, and I do. And he puts them on probiotics. And I find that putting people on pumpkin, puree of pumpkin, or just plain pumpkin does a better job. And I can get people out of systemic candidiasis in a matter of about 2 weeks. Now, Dr. Crick also maintains, he puts them on that diet, and he puts them on a nystatin and ketocortisol. He says basically he can never get them off the drugs. Well, they don't have to be on the drugs after I do what I do, for 2 weeks. He said, wow, I never thought of stuff like that. But folks, you can get people out of systemic candidiasis in a matter of just a couple of weeks doing things the way that I just described. And it's very, very simple. Here's Candida 9C. There's the yeast connection by Dr. Crook. Has the information that we just went over in that. And the aldehyde, acetaldehyde 9D and 9E are in those references, and the capric acid is there. Now let's talk about probiotics, okay? And look at this, probiotics has an anti-tumor activity, which we're going to talk about cancer here in a little bit. So anti-tumor activity. And and it helps with estrogens, progesterone, testosterone. So your sex hormones need the right flora. It can help get rid of gonorrhea. Can help with bile acids. Here's gonorrhea again. Genital lactobacilli can help with the candidiasis, the fungus, Candida albicans in the vagina. It also helps with the immune system, resistance to infection, helps with steroid metabolism, mucus, gut enzyme metabolism. They possess several steroid hormone metabolizing enzymes. So the stuff in your gut can, and we already mentioned biotin and vitamin K. So these can help with a whole lot of issues. Chronic constipation, which we already knew about, but colitis, look at that. Sprue. Now sprue, we already talked about with folic acid. Remember we talked about folic acid being able to inhibit sprue? Well, actually, the lactobacilli and the bifidobacteria in the intestines help do that too. Heck, all I thought was that it's a result of wheat. No, it's not. These people don't know all the facts. They haven't done all the studying that they should. Dermatitis and eczema. Here's another thing that helps eczema, which we just talked about. Potassium, magnesium are in a balance. If one is taken, the other decreases. So if you get too much potassium, then it depletes magnesium. If you get too much magnesium, it depletes the calcium. Magnesium and calcium compete for the same binding site. So don't take them together in large amounts. One here, 7G. This is Modern Health and Nutrition by Goodhart and Shields. And here we find that calcium, potassium, sodium, magnesium affects the metabolism of each of the other three ions. Go straight through to here. Magnesium content was shown to vary directly with muscle potassium levels and independent of other body magnesium stores. So that correlates quite strongly also with the magnesium, potassium are the most abundant minerals that are used in enzymes. So we always take those together and recommend that they be taken together. Fats, lipids, and metals taken together in the intestinal tract and the heat and moisture undergo saponification, be inert and aren't absorbed well. We covered that in the vitamin D and calcium sections. Acrolein or acetaldehyde, same type of stuff. Let's see if we can find that. 6I acrolein. So here we are for acrolein. It's also called acrylaldehyde. This is in the Condensed Chemical Dictionary, 9th edition. When I first found out about this, I read about it in a medical nutrition textbook, and it just mentioned that it irritates the sinuses, and I thought, I wonder if there's more to it than that. So I called the government section, Division of Chemistry, and I asked the guy about acrolein. He said, oh, acrylaldehyde, and I'm going, wow, you knew that right off. So I said, could you send me information on it? And he sent me the following. Again, this is out of Condensed Medical Dictionary, 9th edition. Then we have the NIOSH OSHA Pocket Guide to Chemical Hazards. There's acrolein. And basically, when you have it, Acrolein or acrylaldehyde is formed when you start getting, right when you start getting a burnt smell, so burnt oils, burnt steaks. So frying and high heating of oils is where you get this from. So when you grill something, for example, you're going to get this. When you toast something and you slightly burn the toast, you're going to get this. You burn the butter when you're burning. Here's Acrolein. Irritates the eyes, skin, mucous membranes, abnormal pulmonary function, delayed pulmonary edema, chronic respiratory disease. So there's a whole lot more to that Acrolein than what was in that short medical diatribe, that I read. And so it can cause lots of problems with the lungs and the eyes and the skin, any type of mucous membrane type of disorders. Okay, cholesterol oxides. So let's talk a little bit about things that can cause deposits in the arteries. And so we're going to go right into that here. Okay, 6J, cholesterol oxides. Stale food versus fresh food by Robert Ford. So here we have, he's talking about the Maasais and Mongols, which we talked somewhat about earlier. They eat a lot of fat, but their food is fresh and raw. If they fed garbage to hogs, stale grain, dry hay, and it causes a lot of problems in disease in the livestock. But those that are fed fresh, raw food have little or no trouble. Now, famous scientists have long ago proven that arteries have their own natural cleansing system. Arteriosclerotic deposits tend to be self-cleansing. And here, Dr. Katz, Pick, Gore, Jones, Moses, Brent, and others, their writings may be read in ethical medical books such as Atherosclerosis, Evolution of the Atherosclerotic Plaque, Atherosclerosis here. Basically what they said is if the formation of new deposits were stopped, the arteries would in time clean themselves. Practical results of fresh food diet have fully vindicated their prediction, at last providing a way to stop formation of new deposits so the arteries can be clean in a few months. Now, as I read to you shortly before, in a patient of mine, we got rid of the plaque in 3 weeks by putting the person on a diet of just raw food only and gave her lecithin, and it got rid of the plaquing in the abdominal aorta, and that was sunflower lecithin, and got rid of the fatty liver both. And here talking about crystalline cholesterol or oxycholesterol, oxidized cholesterol, is a problem. Cholesterol isn't a problem. 2/3 of your nervous system, your central nervous system, is cholesterol. Your body makes 2/3 of its own cholesterol. Even if you don't get it in food, your body produces it. It's the oxidized cholesterol that cause a problem, such as in overcooking foods, okay, and eating stale foods. And here it's been demonstrated that people adopting the fresh food diet have experienced many benefits, even though eating much meat, fat, eggs, and raw milk every day, blood cholesterol content has dropped to levels usually found in young children. High blood pressure has dropped to normal or below. Signs of arteriosclerosis in the eyes, etc., have disappeared, which we showed you before and after out of the medical journal on a low-fat diet. Ear noises, high tone deafness, enlarged prostate gland, fibrous enlarged womb, tooth decay, dental calculus or tartar, youthful vigor and appearance, excess fat has been reduced, posture improved, remarkable improvement in growth and health of children. And here we had 58-year-old black man was prematurely aged with a bent posture, shuffling gait, irises of eyes nearly covered by a light gray atherosclerotic haze called arcus senilis. Skin the color of ashes. Given fresh food, fresh milk, man began to straighten up within 10 days. Within a month was dramatically improved. 2 months his eyes had nearly cleared up. Natural brown color was revealed. His skin was a smooth, rich brown color. He walked straight and strong. So you can reverse aging very quickly in someone by reverting to fresh, raw foods. Okay? 14-year-old boy was put on a good fresh food after a life on stale food. Initially this boy was chalky pale, had poor thin hair, pimples, narrow shoulders, was a mouth breather with thick half-closed eyelids. Receiving fresh food, new raw milk in a few months, was growing rapidly, had ruddy skin, thick hair, alert eyes, kept his mouth closed. Developed a broad-shouldered Herculean virility seldom seen at those times. Three-year-old child who was once very thin and wretched with a thin, wizened face, twisted jaws, given unlimited daily supply of new raw milk from a cow eating green, young oat and ryegrass. On tasting the milk, this child refused all other food and drink for several days, drank milk by the quart. Within a few weeks she grew so fast she had a whole new set of clothes. Now we're talking about raw milk taken from cattle that were fed raw food, not these stale grains and stuff that a lot of cattle are fed here. Okay, so this is raw, fresh milk. I can tell you that I've read stories about studies that were done on calves that were given raw milk from the teat, and they were very virile, had hardly any problems. And then they put it in a bucket, and the calf drank directly out of that, and they started having some problems. Then they left it there for an hour before they let the calf drink it. They had more physical problems. Then they left it 3 hours. Then a day. The further away from the teat that it got, the worse the problems they had. So as it was away from the teat, it became more and more oxidized. Okay, so you have the oxidized or oxycholesterol. And the worse, as it shows here, and in some other things we're about to go over, the more stale food that the cattle got, the worse the cattle and the calves were. So it matters how oxidized the milk is afterwards and how good the food is that the cow itself is getting. Okay, and I don't have this picture out here so you can see it. I probably need to redo that. The accompanying picture shows the results of feeding pasteurized, homogenized milk to roosters, which cause severe stunting of the male sex glands or testicles. Small, deformed, diseased glands came from roosters fed store milk, whereas the large, powerful gland came from rooster-fed new raw milk. Okay? And the store milk roosters did not develop big combs and plumes. Some could hardly be distinguished from the hens, couldn't breed, were dejected and spiritless. On the other hand, the male chicks receiving new raw milk grew rapidly, huge splendid roosters, fierce, powerful, ready to fight or breed on a second's notice. All chickens, male and female, which were fed store milk, had greatly enlarged livers of slight yellow color and fatty texture, whereas the raw milk chickens had normal wine red livers. No noticeable arteriosclerosis occurred on either milk. And we're talking about degenerative sex glands who were given raw food and came out and became a whole lot better. So raw versus fresh, raw and fresh. Xanthine Oxidase 6M is in mother. So here is Kurt Oster, MD, and cholesterol fallacy. Studies indicate cholesterol is not responsible for starting heart disease. Now, we're distinguishing here. Now, take this with a grain of salt, because we're talking about overly cooked, overly stale food versus fresh food, okay? Dr. Michael DeBakey, a heart surgeon, performed a study using a large number of patients at Baylor University, that's in Texas, found out of 1,700 patients who had atherosclerosis, which was so severe they required hospitalization, only one patient out of 5 had high serum cholesterol values. So the cholesterol versus the atherosclerosis connection really isn't there too much. In another study, half a group of patients with high cholesterol were given medication which was successfully lowered their serum cholesterol levels, but the incidence of severe heart disease remained the same. So the cholesterol drugs really don't help the death rate at all. As in the DeBakey study, this finding suggests some other factor besides cholesterol is responsible for initiating the heart disease. Dietary cholesterol is not related to blood cholesterol levels, which is suggested here. But I've seen studies that show that, for example, in milk and another one in eggs, they did a study on several men. They fed them 30 raw eggs a day. Didn't affect their cholesterol at all. Then they cooked the eggs a little bit and started affecting the cholesterol. The harder they cooked them, the worse the cholesterol levels got. And when they had fully cooked everything in it, then they were at the worst. And the same with the steaks, same type of deal. So basically what those studies showed, that the more you cooked the animal protein, the worse the adverse cholesterol levels got. That's raw versus cooked. Now it's talking about homogenization was introduced in this country in 1932. And homogenization, you pass milk in a blender and under high pressures, it reduce them to a third to an eighth of the size, and we talked about that. And basically, a substance called Xanthine Oxidase, which normally is digested in the stomach, because the fat molecules in the homogenization process made them very small, went through without being digested and caused scarring of the arteries. The body responds to attack by attempting to heal any damaged area. Calcified plaques and scar tissue represent stage of the healing process, and deposits of cholesterol and fatty material are laid down over the scar, so they're patching it up. Now there is xanthine oxidase normally in the blood, but not in these high amounts. So basically that goes over the homogenization, causing plaquing in the arteries. And pre-boiling milk inactivates most of xanthine oxidase, and they don't have the disease right there, because it basically takes that out of there. And antibodies to xanthine oxidase were found. Patients with severe arterial sclerosis had high quantities of the antibody. So you have antibodies to this xanthine oxidase, of those that were not pre-boiled. Okay, Dr. Oster knew that if his theory was correct, folic acid therapy would have to help reverse the atherosclerosis in patients. He selected elderly diabetics for study. In such patients, atherosclerosis is often so extensive that circulation of the extremities is inadequate. Toes and fingers suffer the most, toes becoming discolored, they have an ischemic discoloration, and they display surface ulcers. For 3 weeks, patients were giving 80 milligrams of folic acid daily, and it helped considerably. And the surface ulcers showed significant improvement. 17 of the patients who had poor eyesight were given the folic acid, and the vision improved in 15 of the patients. And so basically it talks about B2 and niacin, folic acid, PABA, lecithin, and vitamin C. So they use a lot of stuff to help them, but the basic thing was to get the xanthine oxidase out and stop the smoking. Look at that, caffeine from coffee, tea, and cola plus nicotine from cigarettes also constricts blood vessels, speed up the pulse rate. Sodium, okay? So all of these things can add to the problems with the arterial walls. Apoprotein A, 6S. This is Matthias Rath, MD. How vitamin C prevents heart attacks and strokes. And we're talking about properly metabolized vitamin C, if you remember that. Basically, everybody thinks that the plaques in the arteries are cholesterol. He went and he said, I wonder if that's right. And he found that only about 5 or 10% was that, and the rest was apoprotein A. Well, how do you deal with it? You get away from cooked foods and stale foods. You start getting on raw foods, and that's what all this is about. So basically the cure is the same. He just found that the mechanism was different than had been supposed. (6H) Chlorine. Okay, here's Coronaries, chlorine, cholesterol and chlorine, Joseph Price, MD. So here's another thing that causes plaques. Possibly the first thing, and everything else is on top of that we talked about here. Now, anonymous, well-organized ignorance often passes, unfortunately, for wisdom. So let's see if we can get everybody educated here. There's no direct evidence to exist that to prove that lowering blood cholesterol by any method possible will decrease the risk of coronary heart disease or stroke or affect the underlying atherosclerosis. And the pure and simple facts that the first clinical description of coronary thrombosis, another term essentially synonymous with heart attack, was made as recently as 1912. The great Canadian American physician William Osler did not mention the existence of the entity in lectures on the heart disease in 1910. So even he did not mention it in 1910. Most amazingly, the world-famous heart specialist Dr. Dudley White, who treated President Eisenhower for his heart attack in the early 50s, did not see his first case of myocardial infarction, once again another term essentially synonymous with heart attack, until after 1920. So this is a relatively recent phenomenon. Basically unknown in China. They have nauseatingly fatty diets. Eskimos high in raw fat, again raw. Okay, if you want to know something a little nearer to home, we have that too. A few years ago, there was an article in a popular magazine about a small town called Roseto in the hills of Pennsylvania. People in this town of Italian descent tended to be obese, ate a diet abnormally high in animal fats, yet seemed to be immune to heart attacks as long as they did not move out of the community. A little more food for thought. Cholesterol is one of many contributing factors influencing atherogenesis. I am implying that even if a person changes his diet to one low in cholesterol and saturated fats, he's not guaranteeing himself immunity against heart attack and stroke. Persons who do not smoke get heart attacks and strokes, although less than those who do. Okay? And he says, have I come up with some original theory that all the best minds in the entire world over a period of many decades have overlooked? Indeed, I have. And he's looking at some facts that have been ignored. So he talks here about dairy farmers are required to use chlorine when they're cleaning out the milk storage vats, and afterwards it leaves yellowish deposits. And, you know, amazingly similar to the plaques in the arteries. And he's talking about the chlorine in the water. And it's, in my opinion, certainly one of the greatest paradoxes of recorded history that one of the very same public health measures which have been primarily responsible for the great increase in statistical life expectancy in the Western world should also unsuspectedly be responsible for many of the chronic disorders of later life. Experimental use of chlorine to purify water supplies began in the late 1890s. Chlorination gained relatively wide acceptance the second decade of this century, and in the third decade, 1920s, it was found that satisfactory killing of organisms was dependent upon a residual of chlorine in the water above the amount necessary to react with organic impurities. Once remember that evidence of clinical disease from atherosclerosis takes 10 to 20 years to develop, it becomes evident there is a correlation between the introduction and widespread application of chlorination of water supplies, the origin and increasing incidence of heart attacks. It's difficult to explain away. Basically stating that Eskimos and Chinese basically don't have the incidence that we have. And in the Korean War, our soldiers were so heavily chlorinated for sanitary reasons, it's almost undrinkable. And basically, they were showing that they were having heart attacks and plaques in these young soldiers as early in age as 18 or 19. And it's because of the heavy chlorination. And basically they started giving chlorinated water to animals, and it started causing problems in the animals as well. Distilled water, nothing. I'm going back to saying, you know, use distilled water. And you'll see amazing type of things happen just from shifting to distilled water. Results were nothing short of spectacular. Within 3 weeks, there were grossly observable effects in appearance and behavior. The group became lethargic, huddled in corners, except at feeding time their feathers were frayed. So here were chickens that were given chlorinated water. They started clogging up their microcirculation right away. Guess what? They ended up with hemorrhage into the lungs, enlarged hearts, and at 7 months there were so few experimental chickens remaining alive, survivors were sacrificed with the identical findings. At the same time, 1/3 of the apparently healthy control group, those that weren't given, were also sacrificed with not one abnormal aorta found. So, you know, it caused problems with the aortas. Although these results seemed conclusive, it was decided to repeat the procedures, taking the healthy control animals to the first experiment, dividing them also into an experimental group receiving chlorine and a control group. Once again, the roosters receiving chlorine showed fantastic gross changes in appearance and behavior within 3 weeks. First change noted was remarkable paleness of the combs. They followed by gross atherosclerotic lesions of the aortas within months. So this is one of the reasons why I say get on distilled water, get off that tap water. Now they've known for years that all you have to do is pass the water under ultraviolet lights without putting chlorine in it, but we're getting rid of waste products in the chlorine, and we don't want to do something so easy as just passing it under ultraviolet lights. So there's something else that clogs the arteries up. Well, let's talk about validity of medical tests. So first a comment, back in the early or mid-80s, they did a study. I probably have it back in my notes somewhere, that they took a known sample and they sent the blood sample to the 12 top labs in the country, including like Mayo Clinic, Johns Hopkins, UCLA Med Center, etc., etc. 60% of them got it wrong for whatever reasons, okay? I've had occasion to do blood tests on several thousand people. I've had over 40,000 patients from all 50 states and 97 countries. And people come in to me and they're all up in arms. They're going, I have these blood tests that are really high, and they want to put me on 4 or 5 drugs. Do you know anything to do about it? First thing I say is, how long did they have you fast before they took it? And when I first got into practice, they had you fast 14 hours. Now they may not have you fast at all, or it may be as low as 4 or 6 hours. And that's what most of these come out with. And then I ask, were you under any stress at the time? And they come up, oh yeah, I had tremendous stress here and here and here and here. Say, okay, let's wait until the stress gets down to a pretty manageable level, and let's send you back to the same lab, only we're going to fast for 14 hours. Virtually always the tests come out fine, and there's no problem whatsoever with them, okay? And I had a student from North Texas University come to me, and he called up and he says, I got a really bad problem. I heard you do things different. Can I come in? I said, yeah, sure, come in. So he comes in and he gives me his lab tests. And the lab tests show that he was high in 3 separate tests for syphilis. He says, man, unless I can get it off a toilet seat or a doorknob, there's no way. And I said, how long's it been since you had these? He said, 60 days. I said, okay, let's wait 30 days. We're going to send you to another lab, run the same test. They came out negative. Nothing wrong. He says, now I'm confused. I said, don't be. We're going to wait another 90 days, send you to a different lab. So we did that, came out totally normal. Now, whenever you get a positive test for venereal disease, they have to report it to the authorities, in the county, and so county health. And so I said, okay, you take these to your MD, you take them to county health, you take them to the lab, you say, I want my name taken off of here. Either the machine was miscalibrated or they switched my test with somebody else's. And that happens more than you want to know, folks. Okay? And say, take my name off of this list, of having this disease, because I don't have it. So, now let's look here. Now, LCIS is lobular carcinoma in situ. So I had a patient come in with this test, and and she was told that she had it. And she said, "Can you tell me anything about it?" So I called up the CDCP, Center for Disease Control and Prevention, and I asked them, for information on that. And now they don't give out the information, but they tell you where to go to get it. So they send you to the appropriate organization. So I got a hold of the organization, and this is one of the things that they sent me. Let's take a look at this. Unfortunately, there is no sharp dividing line existing between atypical lobular hyperplasia and LCIS. Now, what they tell people with LCIS is that when you have it, you have a 25% likelihood of getting breast cancer. Okay? But here they're admitting that there's no sharp delineating factor here. And the diagnostic criteria for this distinction varies among experts. They don't even agree on it. Some authors require at least 50% of the spaces in a given lobule be filled with and distended by the characteristic cells to warrant a diagnosis of LCIS. So I called up, based on this, I called up the pathologist who made the diagnosis, and I said, what percent of the cells were filled with debris? And he said, huh? This is how wrong some diagnoses may be. And so you got to watch out for stuff like this and be very aware of things of this nature. Let's look at 6V. Brian L.G. Morgan. Now, Brian L.G. Morgan, when I did my master's in biology emphasizing human nutrition, we met in Kansas City, and actually there were 4 cities it was being given in: Montreal, St. Louis, Kansas City, and Los Angeles. And while we were taking the course, which was 18 months, and we did 16 hours intensive each weekend, those 4 made the Final 4 in the World Series. So we thought, hey, that's pretty good coincidence. Well, this doctor was the joint appointment at the institute here, Columbia University College of Physician Surgeons, Columbia School of Dental and Oral Surgery. And so he's really high ranking. We had visiting instructors from Yale, Harvard, Rutgers, Princeton, Columbia University, Vanderbilt, USC, UCLA, all the top schools. They did it right. Okay? Now we already went over the folacin-rich foods for cancer. We already went over that. Well, let's look at zinc. Okay, zinc is in a balance with copper. So when you have too much zinc, you're going to deplete copper. Remember, copper is necessary for connective tissue, cross-linkages. It's necessary in about 7 to 9 different enzymes in the body. It's necessary to make red blood cells, for example. Well, we have people that are taking zinc supplements in the winter to prevent colds. Guess what? If you're taking too much of this, it depletes copper. And that presents a problem with anemia and with vitamin C. So it can cause, several different issues there. So here, if you remember, I talked about not taking high alkaline foods with antihistamines. By the way, this is all taken out of his book. All this was taken out of the Food and Nutrition Interaction Guide. It was taken directly out of the physician's drug references. and desk reference. And he said it took him 3.5 years to study this. And he said you'd think it would take maybe 3 months, but it took 3.5 years. He said what I did, and I recommend all you students do it, and by the way, all the students in this were doctors and nurses. That's all they allowed in. 2/3 of the doctors and nurses did not pass. You had to have at least a 3.25 grade point average to pass the course. 2/3 of them did not pass this course. It is very, very difficult. Okay, antihistamines. Hazardous buildup if you have alkaline urine. So you don't want to take high alkaline foods with this. It can give you the inability to concentrate, dizziness, poor coordination, drowsiness, and a dry mouth. Fruits, vegetables, dairy products tend to be alkaline and cause this. And so basically, again, when you're taking antihistamines, you can't be eating a really high alkaline diet, or you're going to have an acidic urine and go into alkalosis and have all those issues. And all of these are in your notes, and I would suggest you read through them. Now look at this, acetaminophen. Avoid vitamin C supplements when you're taking acetaminophen. Side effects: diarrhea, sodium depletion, kidney damage. Very high doses of vitamin C can prevent the body from excreting acetaminophen. Also avoid tea, coffee, colas, etc., herbal teas. Aluminum and acids. Avoid fruit juice. So when you're taking antacids, avoid fruit juices. Coffee, tea, chocolate, and cola. Wow. A lot of people are having a lot of these while they're taking antacids. Possible side effects: phosphate and calcium deficiencies, kidney stones, constipation, deficiencies vitamins A, D, C, D, B1, folacin, magnesium, and iron. Tyramine-enriched foods, amphetamines, okay, must be restricted while you're being treated with amphetamines. Tyramine is common in many foods, but it's found in the greatest amounts in high protein foods that have undergone some decomposition, such as aged cheese. Also found in chicken and beef livers, bananas, eggplant, sour cream, alcoholic beverages, salami, meat tenderizers, chocolate, yeast, soy sauce, raisins, avocados, and basically this can raise your blood pressure and raise pain and give you migraine headaches, cause cold extremities, for example. So you got to keep all that in mind. Ampicillin, avoid anabolic steroids, avoid salty foods, such as all these. Anchovies, dill pickle, sardines, green olives, canned soups and vegetables, TV dinners, soy sauce, processed cheeses, salty snack foods such as potato chips and cold cuts. Possible side effects: edema and irregular heartbeat. Wow. So there's the bodybuilders. Androgens, avoid salty foods, same things. Goes the antihistamines again. Here's antihypertensives, And it says avoid the tyramine foods again. Boric acid, which is a preservative in a lot of things. Now look at this, clear eyes, murine, possible effects, riboflavin deficiency. Remember we talked about caffeine impairing the absorption of iron? Well, there's one here, and we're going to show you some other ones here in a little bit. Deficiencies of phosphate, folacin, iron, thiamine, magnesium, constipation, action of calcium carbonate. It's a therapy for stomach hyperacidity. That's calcium carbonate for hyperacidity. So that can cause problems. Calcium supplements. So a lot of women are taking calcium supplements every day because they're told to by their MDs, their chiropractors, their nutritionists. An overdose can result loss of appetite, headaches, excessive thirst, irritability. How many of your patients have that? You need to ask them about their calcium intake. Antibiotics. This particular one, chloramphenicol, deficiency in riboflavin, cracks around the nose and lips, corners of the mouth, B12 deficiency. I just pulled some things out here. If you can get a copy of this, it's well worth the price. I'm just going over some what I think are very, very pertinent things in here. Anti-gout medications. Avoid coffee, tea, cola, herbal teas, alcoholic beverages, dairy products, sweetbreads, anchovies, sardines, liver, kidney, meat extracts. And we talked about vitamin C helping with that also, but keep them off all these things. Corticosteroids, avoid fatty foods. Erythromycin. Now, several antibiotics says to avoid fruit juices. Colas, sodas, and wine. But we take them because we think it will help us. EDTA, chelation. Well, we think, well, we need chelation, but guess what? This is in most frozen foods. So if you eat a lot of frozen foods and it's got EDTA in it, it's going to bind up calcium, zinc, manganese, iron, and copper and keep that from being absorbed in your system. So if you see people whose minerals are off, ask them, are you eating a lot of frozen foods? Because remember we talked about vitamin E being destroyed by it? Well, if this is in it, then that's going to cause all these things to happen as well. Ferrous supplements. Do not take supplemented milk containing grains, eggs, tea, dairy products. That's because of the phytic acid, the tannic acid, and the caffeine. Anti-anxiety drugs. Accelerates the rate at which the liver breaks down vitamin D, permitting it to be excreted before it's fully effective. Remember, vitamin D has to go through the liver and the kidneys to get in a form where it helps absorb calcium, if you remember from early on here. There's antibiotics in fruit juice, sodas, and wine again. Here's antibiotics, fruit juices again, sodas and wine. Antibiotic, fruit juices, soft drinks, and wine. Here's potassium. Avoid dairy products when taking potassium supplements. Wow. Have we ever told any of our patients that? All potassium compounds impair the absorption of vitamin B12. Oh my gosh. Wow. You don't want that in older individuals especially, right? Sodium bicarbonate. So here we're taking foods that have sodium bicarbonate in it, for example, or we're taking antacids, either one. Side effects: hypertension, poor appetite, nausea, vomiting, headaches, feelings of weakness, impaired vision, poor absorption of most nutrients, kidney damage. And there are books out on taking sodium bicarbonate as a cure-all for everything, but look at all the things that it can cause when you're taking too much of it. Let's say all you're eating is baked goods that have sodium bicarbonate. Your patients are coming in with these things. You don't know what's causing them. You're just trying to give them stuff to take, but you never think about taking them off the sodium bicarbonate. Look at all this. Get them off the baked goods that contain it. Wow. There's thyroid hormone and the goitrogens that we talked about. That's right in the physician's desk reference. Here's zinc and copper again. Taking zinc can lower copper and cause nausea and diarrhea. So you ever think that people you're giving zinc to during the winter months to avoid colds, you're giving them nausea and diarrhea from taking it? I was never told that, were you? Here's more acidic foods. There's calcium-rich foods right here. There's the folic acid foods again that we talked about. There's the goitrogen-rich foods. Here's oxalate foods that can cause kidney stones, for example. And I had this lady come in and she had low blood calcium and she wanted to get it back up. And she was taking calcium supplements, but it wasn't doing it. So I said, okay, and I got her to get off of the acid foods that was eaten up and helping the body excrete them. Got her off of the tannic acid foods, the caffeine foods, the phytic acid foods, etc., etc. And so her blood calcium went up just very quickly. I said, look, what you don't want to do is you don't want to eat spinach salads. And 6 months later, she comes back and she's forming kidney stones. She says, what's going on here? And I said, show me what you're eating. And sure enough, she was eating. She didn't listen to what I said, and it was right in a written report. And I pointed it out to her. She said, oh, I didn't understand. I said, how could I do it any different than that? I told you it could do that. And she just got off the spinach and the stones went away. So you have to watch that when you're having high alkaline diets and you're that certain susceptible person, you may start forming stones, okay? Protomorphology, 7A. Okay, we talked about this when we talked about hormones. Now, let's talk about this a little bit more. I got curious about this because we have gland extracts and raw glandulars. And basically the supposition behind this is that they're labeled and the body takes a significant amount of those proteins out of the animal that you ate and puts them in the organs that you have to help that organ. That's the presumption behind that. And so I decided to test that out, and had a divorce from my first wife, and I had 5 children with them. Well, I got them for 6 weeks in the summer. So I decided to test this, and my older 4 children were basically getting an age, they were teenagers, they wanted to lift weights and stuff like this. So without telling them what I was doing, we had every night chicken breasts. And they could not believe how quickly their bench press strength was going up. They just could not believe it in the first 3 weeks. But they said, you know, how come our leg strength isn't going up? So without telling what I was doing, I switched to chicken thighs. And it was all boiled meat. We had boiled meat. So every night we had chicken thighs. And then their leg strength started exploding. And basically the chest strength kind of stayed there and went back some. They couldn't believe it. Now, every one of them has taken this course, and they didn't even know that I did it until I took this course, and they all remember, and they said, oh, we wondered what did that. So, you know, that is one way to do it. Now, if you want an easy way to give these things to people, the yolk of the egg turns into the nervous system, and it turns into all the internal organs, okay? So if you want a quick, inexpensive way to do this with people, tell them to eat 1 or 2, like sunny side up or over easy, egg yolks every day. And that's a quick way to do it. If you cook it all the way through, it's not going to have this effect. So you have to have it relatively uncooked, okay? They may not want to eat a raw egg, for example. But this is a very quick way to do it, an inexpensive way to do it without giving the expensive glandulars. Now, enzymes themselves, this is number 7. This is out of government. You can go online, and this is where I got these from. If you want to read up on enzymes and all the classifications and nomenclature, just go there and do that, and that's on number 7. Cooking and binding. When you have raw beans, you got to soak them and cook them, and that takes out some of the bad effects out of the beans. Of course, you want to soak and cook the hard beans anyway. 7Q. This is vitamins C, E, and A. So here's tocopherols. Remember I said it's not in olive oil. It's only in oils that have polyunsaturated oils in there because it needs the vitamin E to protect it, but olive oil doesn't because it's monounsaturates. Look at that, it's in green leaves, and it's in peels, meat butter, eggs, yolks, fish livers. Basically seeds of fruits and vegetables are loaded with it. Selenium is necessary for it to work. Now, vitamin E has a sparing action on vitamin A. Remember we went over that. And ascorbic acid and the phenols have a protective action on vitamin E. So C protects E, E protects A. And here's the bioflavonoids, which have a chelation action on metal ions. Remember we went over that. Let's talk about atrial fibrillation. Mayo Clinic Proceedings, April 2013. You can get this by just entering on the internet, the question, drugs that cause atrial fibrillation. Look at this, it goes down through here. The only drugs that are mentioned are excessive vitamin D and excessive niacin. When I first got out of school in 1980, chiropractic college, all we heard about was ventricular fibrillation. We never really heard of atrial fibrillation till maybe the mid or early 2000s. Guess what? Before that, medical doctors, the only vitamin they really believed in was B12 for the central nervous system, basically giving injections to older individuals who can run down on it. And we discussed why they run down on it earlier. But then they discovered vitamin D. And if you remember, that was actually discovered as a hormone back in the 1930s and 40s. And they finally figured it out and found it in the early 2000s. So they started giving vitamin D to people in pharmacological doses. And they found niacin. And they found that niacin helps clean out blood vessels and plaques. So they give pharmacological doses of niacin. So what do we have as a result of this? They've induced, and we've induced, because we did the same thing, we read the same literature, we've all induced atrial fibrillation in the population by overdoing niacin and vitamin D. When for the niacin, all we've got to do is give them B6, because B6, if you remember, turns tryptophan into niacin. The body makes what it needs. Vitamin D, as you recall, get sunlight, direct sunlight to the face and the palms of the hands 15 minutes a day, maybe in the winter 20 or 30 minutes a day, and you get plenty of vitamin D. We don't need to be giving people all this stuff. We need to give them sunlight and B6. But remember, B6 is depleted by milk, pasteurized milk, and by cooked animal proteins. So we need to back off on cooking things, okay? And that solves that particular issue. Now, what about grains? Top 4 healthy grains. One of these is actually not a grain. Quinoa, which we think is a grain, an ancient grain, is not a grain, but it's related to spinach. Okay, so if somebody is a stone former, you want to keep them away from quinoa, okay, because of that. And some of those other things we talked about, spinach, if you have low thyroid function, and you might want to keep them off of quinoa if you remember the goitrogens, okay. But the most alkaline grain is millet, also known as sorghum, okay. And so, that basically is some of the reason that I wanted to show you that. You got brown rice, you have buckwheat groats, okay. But basically those are the couple of things that I wanted to show that to you for. Mustard oil, 8B. Nociceptive behavior induced by mustard oil injection into the temporomandibular joint. Okay, basically they injected mustard oil to inflame and cause hyperalgesia into the joint, okay? And basically the reason that I'm showing you this is that when we talked about arthritis, basically we're told that the nightshades, like potatoes and tomatoes and etc., paprika and eggplant, cause arthritis. But we were never told about brassica, which is the mustard family, which includes mustard and cabbages and crucifers, including kale, by the way, which is real popular right now. And so I was reading through the a book on chemicals, and I came across brassica being talked about in mustard oils, and I thought, wow, because it talked about the irritation that it caused, and I thought, you know, they use mustard oil for nerve gas, and basically when somebody inhales it, it causes the cells of the lungs to swell so that they don't absorb oxygen. And the people who are inhaling that, they basically suffocate. Okay? And this is from the Merck Index, not the Merck Manual, that I got this information out of. And they've changed that over the years. And so that was an old edition that I was reading through in an old chemistry library. And so I started thinking about that, and I thought, well, what if mustard oil is not cleared out of the system? It's a volatile oil, and it basically breaks down to a point, and it doesn't break down anymore because you're overloading the system by taking too much of it. Then it would cause inflammation. Okay? So, you know, I thought about that, and somewhere right around that time, I started reading about all the benefits of cabbage and all of its healing properties. And so I thought, I'm going to start eating cabbage instead of lettuce, you know, for salads and sandwiches and stuff like that. So I did that 3 or 4 months, and I started hurting all over. My pores hurt. I'm going, oh my gosh, I understand why people kill themselves over pain. And then I remembered what I read there, and I remembered seeing this. I thought, I bet I'm overdoing the mustard oils. My body's having trouble clearing it out. So I just cut it out. 4 days, all my pain was gone, folks. 4 days. And people who are eating a lot of crucifers can be doing the same thing. People who like mustard on their steaks and everything could be doing the same thing. Kale. So I was given this seminar and told this story in West Des Moines, Iowa. One of the doctors there said, oh my gosh, and it was a male. I said, what? And he says, well, I've been doing smoothies. I started reading all the health benefits of kale. So I started putting 2 leaves in 2 or 3 times a day. I hurt all over. I said, well, just take the kale out. Give me a call in a couple of weeks. His pain was totally gone. It was all from the kale, okay, and the mustard oils. So these are things you need to pay attention to. Here's the paradoxical aciduria that we talked about before. Presence of alkalosis called by hypochloremia. And we went over that. You're taking the antihistamines and a high alkaline diet cause aciduria and trouble breathing. Okay, what about ulcers? We hear about things that cause ulcers. Okay, Helicobacter pylori, right? Well, what does Fundamentals of Clinical Chemistry say about ulcers? In some cases, gastric acidity is high, but in the majority, it's normal. Hypoacidity is sometimes found. Whoa! So it can be high, normal, or hypoacidity. So we know that ulcerations can be caused predominantly from overtaking over-the-counter painkillers. Matter of fact, incidence of ulcerations in the stomach and intestines went up 10 times over a period of 10 years from 1992 to 2002. And that's when, you know, because a few years earlier, doctors started saying they'll take 2 aspirin a day to prevent heart attacks. And by the way, the MD that started that, he put out something in the medical journals a month later, said, you guys read it wrong. The aspirin did not decrease fatal heart attacks. It insignificantly decreased non-fatal heart attacks, but it nearly doubled the rate of fatal strokes. And so over a period of time, it went from 2 aspirin a day to an aspirin a day to a half aspirin a day to a child aspirin a day. Now they're saying don't take it because they didn't want to get sued, okay? And it's ridiculous. They should have just fessed up immediately. And the aspirin producing companies were the ones who fomented that mainly. Here's Atkins' diet. We've been talking about the ketosis rather. And this is in handout number 9. Atkins' diet increases all-cause mortality. 85,000 women followed for 26 years, 45,000 men followed 20 years. Diet based on animal protein increases all-cause mortality. So if somebody asks, what do you think about ketosis diet? Short time, yes. Long time, if you want to die early of anything, go ahead. But no. Now here is Candida. Dr. Crook, we talked about Candida. This is the yeast connection. Dr. Crook. We went all over this information. And the aldehyde with Candida, the metabolic poison put out by the Candida, that's 9D, 9E, capric acid or caprylic acid to strip down the shell of the organism, that's in 9F. So that's right there. 10A, capsaicin. So what about taking large amounts of capsaicin, which is cayenne pepper, for example? Destroy peripheral mechanoreceptors, specifically destroyed by capsaicin, sensitive to capsaicin. Provokes the specific loss of small diameter sensory neurons. So when I grew up, we used to put, they had like Vaseline with capsaicin in it. They call it atomic bomb, and athletes would rub it on to warm them up. Now they have menthol, which we're going to talk about later. Okay. By the way, itch is the same as pain. Ticklishness and itching are different forms of pain. Here we have the destruction of DRG cells with capsaicin. Capsaicin compound permanently destroys some 95% of C fibers. So do you want to use, this is in Textbook of Pain by Melzack and Wall, do you want to use cayenne pepper on everything? Maybe not. Okay, aloes. We mentioned aloes. Now, again, one of the things that we mentioned about aloe is that some people have a general allergy to the lily family, which includes all the aloes, garlic, onions, chives, for example. Okay. Now, this is Bill Coates. This is a pharmacist in Garland, Texas, right by where I live. And he noticed that roadrunners, he was like out on the edge of the city, and he noticed that roadrunners would run around and they would only peck on certain cactuses. And so he got curious one day and he took it to a botanist. And he says, what is this? And he said, Aloe vera barbadensis Miller. And upon further investigation, he found that this type of aloe had 5 times the curative powers of any of the aloes in it. He also found that when you took the gel out of the plant, it would only retain its healing power for 24 hours. Okay? So he had to find a way to stabilize it. So he worked with a very specific company for that, and email me for the name of that company, and I'll give it to you. But we know aloe vera for sunburn, for example, but look at this, scleroderma. Look at how bad it was. This is right out of his book, Here's After. Look at how much that healed. So they took it internal and external. And, okay, there's burns. Here's decubitus ulcers. Look at that, healed up with aloe vera. Now, you're not supposed to be able to do stuff with the decubitus ulcers and scleroderma. Wow. Aloe has its biggest effect on the epithelial tissue. Here is acne vulgaris, cleared up with it. Here is psoriasis, before and after. Psoriasis, before and after. Quite amazing. Again, you put it on and you take it internally. Lupus, before, after. Oh my gosh, I didn't know we could do anything with lupus. Well, yeah, you can. What I do when I'm talking with people about this, I pull out this book and I show them before and after pictures, and they are ready to go. It's not just me talking about it now. There's lupus before, lupus afterwards. There's scleroderma again. Look at that. Starting out, healed. So I always like to pull out medical books and show people, and man, are they ever ready to buy right after I do that. Lobelia, 10C. Here's a School of Natural Healing, John Christopher. Okay, so here's a story about how it was discovered. And by the way, lobeline from lobelia is found in the physician's desk reference for smoking cessation. Okay? Sometime in the summer, after I was 4 years old, 1773, being out in the field in search of the cows, I discovered a plant which had a singular branch and pods I'd never seen before. I had the curiosity to pick some of the pods and chew them. The taste and operation produced so remarkable I never forgot it. By the way, you can get lobelia at any flower shop. Okay? You can get it at any flower shop. And I used, we talked about this for the little girl who had the pustules in the gums, okay? But you can also just get the plant at any flower shop, any plant shop. Afterwards, I used to induce other boys to chew it merely by way of sport to see them vomit. Oh wow, really good stuff here, huh? I had at that time, 8 years old, a very good knowledge of the principal roots and herbs to be found in that part of the country with their names and medicinal uses. The neighbors were in the habit of giving me to go with them to show them such roots and herbs as the doctors ordered to be made use of in sickness and for syrups and etc. By way of sport, they used to call me doctor. While in the field of work, I often used to find the herb which I tasted when 4 years old, gave it to those who worked with me to see them spit and vomit, but I never observed any bad effects produced by it. The herb which I discovered when 4 years old I had often met with, never occurred to me that it was any value as a medicine until about this time. 91, he was about 20 years old roughly. When mowing in the field with a number of men, I cut a sprig of it and gave it to the man next to me who ate it. When we got to the end of the piece, which was about 6 rods, he said he believed I'd given him something that would kill him, for he'd never felt that way before. I looked at him and saw that he was in a most profuse perspiration, being as wet all over as he could be. He trembled very much. There was no more color in him than a corpse. I told him to go to the spring and drink some water, and he attempted to go and got as far as the wall, was unable to get over it, lay down on the ground, vomited several times. He said he thought he threw off his stomach 2 quarts. Then I helped him into the house. About 2 hours he ate a very hearty dinner, and in the afternoon was able to do a good half day's labor. He afterwards told me he'd never had anything do him so much good in his life. I have made use of it in every disease I've met with to great advantage. So lobelia is really something else. In herbology, it's a specific for asthma, okay? And it's an expectorant and a nervine herb. So basically you can rub it on anywhere for pain, and it'll help take care of it. Take it internally for that. And I'll give you an example for the asthma. I had a lady come in to me. Her doctor had been in an auto accident. He fractured 3 or 4 ribs, so he couldn't treat anybody for a while. So he referred her to me. She came over for a neck issue, you know, so she'd come over and I'd adjust her, and she asked if I could do anything for asthma. And at that time I was looking into iridology. I'm certified in 2 or 3 different courses in iridology, so I took a magnifying glass with a light on it, and I looked in her eyes. Very dark brown on one side, very dark brown on the other side, but there's an itty-bitty spot of blue. I said, according to iridology, you actually have blue eyes. She said, you know, I had bright blue eyes up until I was 3, and then they turned brown. Now, she had asthma that was so bad that she had 7 major attacks every day, and once a month she landed in the ER. Okay, that's how bad it was. So I had her go and get extract lobelia, put a full shot, dropper full under her tongue, and usually within minutes after doing that, she started coughing up phlegm out of her lungs. Now remember, she was, it's an expectorant. And she was coughing up so much, she just loved it. She noticed she was doing so much better with it. And so she was getting one of these small bottles a day and going through a whole bottle a day. And in a year and a half, she went from having 7 major asthma attacks a day and going to the ER once a month to having a very mild asthma attack once a month. And her eyes turned bright blue. It's just amazing stuff. Now, we have other things to do for asthma in parts 1, 2, and 3, physical treatments. And now if lobelia isn't working by itself, we also give mullein as an expectorant, okay? Which I'll talk about that in a minute also. And if that doesn't work all the way, you get sage and thyme, which are in your herb cabinet, and you make a tea out of it, a couple of teaspoons each in a pint of water, distilled water. So you bring the distilled water to a boil, you dump in the herbs, and you steep it for 20 minutes, and you stir it occasionally during the 20 minutes. Then you strain it, drink it down as hot as possible, and then jump in as hot a tub of water as you can. And the sage is a diaphoretic, it helps you sweat. And the thyme basically is bacteriostatic, it helps kill bacteria. And and it also is antifungal, the thymol in it. And so you're in that real hot tub, just hot as you can tolerate, for 15 minutes, and then you jump under 5 covers. And this, you just perpetuating the sweat. You can only do this maybe once or twice a month because it just exhausts you. But I've had people get rid of the very worst cases of asthma that wouldn't respond elsewise by doing that. So there's another way to go about it as well. Okay, nicotine. 5th edition Guyton. See what it has to say about nicotine. So we're going to vaping instead of cigarettes. How good is that for you? Nicotine excites both the sympathetic and parasympathetic systems at the same time, resulting in strong sympathetic vasoconstriction and parasympathetic effect at the same time. You think that's screwing up your nervous system? Absolutely. It's right out of Guyton's. Composition of foods, 10D, is in dog. So I always heard that iceberg lettuce, which is also known as head lettuce, wasn't really good for you. It didn't have much of anything in it. So I went to USDA Depository, and they had these books and I found composition of foods. And at that time I said, how much for this? And he said, just take it, your tax is already paid for it. So, okay. So I took it, and you can probably find them online now, I imagine. Anyway, composition of foods, USDA. And so I photocopied, and I still have this, I photocopied all the green leaves out of it. So loose leaf lettuce and et cetera, et cetera. Well, guess what? Head lettuce, iceberg lettuce, is the lowest on virtually every nutrient in there. And I took care of farmers who produced it. And I was talking with them about it, and they said, well, you know, it's one of the largest turnover cash crops in agriculture. And if you notice, about every fifth layer or so is a brown pitted layer. And you notice that? And I said, well, yeah. And they said that's because we douse it so often with pesticides and herbicides, and that's what's in that layer a lot. And so we put a lot more fertilizer in it, and that's why it has less nutrients. So, you know, iceberg lettuce used in, you know, all the hamburgers, for example, and most lettuce salads and all that sort of thing. So basically, my conclusion is it's got less nutrients, more poisons. Why use it? Now, if you raise it in your own garden, it's probably going to be different than that. But that's the commercial grade stuff, okay? Now, 10E, Guyton's physiology. Here is, remember, we talked about when you chew animal protein too thoroughly or eat ground meat, it turns into fluid and it passes through rapidly, avoids a lot of the digestion. Well, there it is right there. It's in Guyton's physiology. Also, remember, it has to have a pH of about 2, above a pH at 5, has very little proteolytic activity, becomes completely inactivated. That's right in there also. And here we're talking about the bile salts. Here's a pH 2 and 5 again for the pepsin. Now, here I thought was something to talk about. When methane and hydrogen become suitably mixed with oxygen from swallowed air when you're eating, an actual explosive mixture is occasionally formed. Explosive flatus, yeah. You heard you can light it? There it is right there, methane and hydrogen. Here we have flatus from large intestine. Certain foods cause greater expulsion, such as beans, cabbage, onions, cauliflower, corn. Certain highly irritant foods like vinegar cause an irritation of the large intestine, and it causes rapid expulsion before they can be absorbed. Basically, your body absorbs 95% of the gas into the bloodstream before expulsion. Now, vitamin B6, remember we talked about vitamin B6 being a transaminase? Right there it is, right there, pyridoxine. Transforms one amino acid into the other. Here's bile salts and their function. Remember the detergent actions, the surfactants. There it is. That's where we got all this. Remember we talked about negative feedback control in the system. And that's one of the big things that you got to consider whenever you're thinking about giving anybody anything. Right there it is. So when you have high thyroid function, it increases the needs for vitamins. And there that is. Okay. Now, half-life of enzymes is only 1 to 2 hours. They don't last very long in the system. Some of them 2 to 3 hours. They do not last long in the system. This is why it's very important to get raw foods so you have the live enzymes. Now let's talk about half-life of different proteins in the body. Intestinal mucosal cells turn over rapidly in a few days. Half-life of just a few days, meaning the most that they're going to hang around the intestinal mucosa is 10 to 12 days. Well, what does that mean? if you do everything right with the intestinal mucosa, you can totally change, like irritable bowel syndrome, for example, and celiac disease, 10 to 12 days. You take away that irritation, you replace everything. So what do? You get them off the acid-forming foods, you put them on mucilaginous substances, such as marshmallow herb. Now that's not the marshmallow candy, it has no marshmallow in it. So you have any type of ulcers or intestinal irritation or something like that, you have the patient take about 10 capsules of marshmallow. Now it's nutritional as well as being a mucilage. So it really helps system, so much so that it has such a good protein value in it that I have women who have children that aren't thriving, and they're being told get them on formula, but they want to breastfeed them. I tell them to get on, while we're changing the diet, get on the marshmallow, 10 capsules, maybe 3 times a day to 5 times a day, and immediately a day later their milk is rich enough. Well, basically it's a mucilage here, and it helps to coat and heal the stomach, the intestines of these irritants from ulcers, etc., etc. Also, I have people get on slippery elm. However, caveat on that, I found that about a third of the people don't tolerate slippery elm so well for some reason. So I always give it to them and say, I just want to see if you tolerate this well. About a third of them don't, and then I just take it back from them. But I usually try and combine those two as a mucilage, and you can really heal over intestinal problems very quickly when you do things that way. Normally in the large intestine, fecal matter is about a third to a half. Dry matter is living and dead bacteria. Here's the intestinal bacteria, production of volatile fatty acids, which have a stimulating peristaltic effect to induce bowel movement. So basically, you want to get off of the volatile fatty acids that may be stimulating this. So you have the volatile fatty acids basically in the spicy foods and etc. It can cause a lot of problems like that. Here we have hypercholesteremic effect of food fiber, binds the bile acids, possibly the cholesterol itself in a non-absorbable complex, and takes it out of the system. So we have vitamin C and fasting and fiber that helps lower the cholesterol levels by taking it out. Here's the phytates, are quite insoluble mixed calcium magnesium salts, and interfere with the absorption of calcium, zinc, iron, etc., etc. Here, remember we talked about cereal rickets from unrefined cereals. This is where I got it, right out of biochemistry textbook right there. Now, calcium to phosphorus is about 1 to 1 in mother's milk. In cow's milk, it's about 4 or 5 to 1. And this is why I think that you have problems with drinking a lot of cow's milk. Gives you the bone thinning properties, because you need calcium to neutralize the phosphorus because it's so much, and so you got to drain it out of the system for that. Here's the detoxification. The detoxified product is sometimes more toxic than the original substance, remember that? And says does not necessarily imply or guarantee that a non-toxic or even a less toxic substance will be produced. Detoxification. Okay, colloids, colloidal particles are large. They're not large enough to settle out by gravity. So I knew about colloidal silver 20 years before I ever used it, because I knew this from reading through this textbook. Basically, the home colloidal silver kits are not colloidal silver, nor are most that you see in health food stores. Like I said, I only know of one company that has true colloidal silver, and that's the only type I've ever used because of that. Basically, how can you tell? Because it settles out, and basically the bottles say if it settles out, shake it back into colloidal form. Well, if it settles out, it never was in colloidal form because they are not large enough to settle out by gravity. You see that? Their salts of bile acids reduce the surface tension of water. And remember, we talked about it helping with surface tension at the cellular level after they're reabsorbed. Here's oxidation, loss of electrons or loss of hydrogen. Remember when we talked about water, we talked about that, the distilled water. Here's some terminology. If you want to get into the terminology, I put that in there for you. 11b, Pottinger, Pottinger's cats. So Francis Pottinger, MD, was given several hundred cats. It's either 200 or 400 cats. So he found that Pottinger Price, a practicing dentist with a congenial spirit of inquiry and a desire to explain the prevalence of tooth decay, facial inadequacies amongst his patients and civilized people, set upon a worldwide odyssey to study dietary habits of 14 isolated primitive peoples. He found that these natives who still ate their customary natural foods, whether primarily fish, meat, or vegetables, showed broad facial structures and a perfection to their dental arches, virtually no tooth decay. While those who had been exposed to civilized diet of commerce based on refined white sugar, flour, canned and packaged food showed narrowing of their faces, crowding their teeth, and a high incidence of cavities. They also showed an increased susceptibility to tuberculosis and other degenerative disease. So they formed the Price Pottinger Nutrition Foundation. So, remember we were talking about grains before from some of the other references here. Industrial byproducts, field-dried alfalfa and grain, learned that the reproductive efficiency of range cows is greater than dry feedlot cows, and a high rate of mortality exists among dry feedlot calves. So the calves being fed by the cows who are eating the dry, stale foods are weaker, and they have more diseases, they die earlier. The fresh-fed cows, including raw milk from dry feed cows, found that the cats fed raw milk from dry feed cows show similar deficiencies as those fed pasteurized milk. So it goes through the cow. If the cow eats the wrong stuff, it goes through to whoever drinks the milk. Okay? So if you have freshly cut greens, the high-grade raw milk appears to lessen the deficiencies produced by the cooked meat. So basically, those fed dry feeds, they fail to germinate. The eggs were thin shells and yolks, and so they're feeding this stuff to chickens. And whatever was fed to the cow goes through the milk in the chicken, and it affects the viability of the egg and how good the chicken themselves are. Okay? Farm chickens get out and scratch for worms, eat green grass and weeds. They lay eggs from hard shells, deep yellow yolks. When these eggs are fertilized, they hatch husky, healthy chicks. In addition, farm chickens have supple skin, firm musculature, almost twice as much calcium per given weight of bones as mass-produced hatchery chickens. So this goes straight through. Okay. Variation: guinea pigs fed dry feed. In this experiment, a group of guinea pigs is initially fed a diet of rolled and cracked grain, supplements of cod liver oil, field-dried alfalfa. Shortly, they show loss of hair, paralysis, high litter mortality, diarrhea, pneumonia, and other deficiency symptoms increase. When fresh-cut green feed, grass after sundown, cut after sundown, sacked and delivered before sunrise, introduced in their diet, the guinea pigs show remarkable improvement. Infant mortality decreases, animals become huskier, no new cases of paralysis develop, alopecia lessens, although it doesn't disappear entirely. Few guinea pigs with severe diarrhea, loss of hair allowed to run outside the pens to feed on the growing grass and weeds. In less than 30 days, these foraging animals show even greater improvement than those receiving cut greens inside the pens. Their diarrhea stops, their hair returns with soft, shiny, velvety texture. They heal and become well. When they are placed back inside the pens, they show no further sign of gastrointestinal upset or other ailments. So, are you learning stuff here? It all goes back to fresh, raw. Fresh, raw, fresh, raw. Normal cats. When they were fed bad food, third generation's inability to produce healthy, viable offspring. Consequently, there are no third or fourth orders of regenerating cats. So this affects our fertility when we're fed this stuff. Effects of heat processed foods and vitamin D metabolized milk. Growth factors in raw milk. Okay? So in this feeding experiment, one group of cats receives a diet of 2/3 raw meat, 1/3 raw milk, cod liver oil. The second group receives 2/3 cooked meat, 1/3 raw milk, cod liver oil. And they looked at the calcium and phosphorus content of the femurs at death, the resistance to infections, allergic sensitivity, reproductive efficiency. The raw meat group show striking uniformity in their sizes, skeletal developments. From generation to generation, they maintain a regular broad face with prominent malar and orbital arches, adequate nasal cavities, broad dental arches, and regular dentition. Configuration of the female skull is different from the male skull. Each sex maintains its distinct anatomical features. Membranes are firm, of good pink color with no evidence of infection, degenerative changes. Tissue tone is excellent. Fur is of good quality with very little shedding noted. In the older cats particularly, the males engaged in fighting, the incisors are often missing, but inflammation and disease of gum is seldom seen. Over their lifespans, they prove resistant to infections, fleas, and to various other parasites, show no signs of allergies. In general, they're gregarious, friendly, predictable in their behavior patterns. When thrown or dropped as much as 6 feet to test their coordination, they always land on their feet and come back for more play. Reproduce one homogeneous generation after another, with the average weight of the kittens at birth being 119 grams. Miscarriages are rare in the litters. Average 5 kittens, with the mother cat nursing her young without difficulty. Cooked meat group. Each kitten in a litter being different in size and skeletal pattern. Almost as many variations in facial and dental structures of the second and third generation cooked meat fed animals as are other animals. Long bones of cooked meat cats tend to increase in length and decrease in diameter, with the hind legs commonly increasing in length over the forelegs. Tuberculations, mesh of the bones become coarser and shows evidence of less calcium. In the third generation, some of the bones become as soft as rubber. and a true condition of osteogenesis imperfecta, or glass bones, is present. Heart problems, nearsightedness, farsightedness, underactivity of the thyroid, inflammation of the thyroid gland, infections of the kidney, of the liver, of the testes, ovaries, bladder, arthritis and inflammation of the joints, inflammation of the nervous system, with paralysis and meningitis, all occur commonly in these cooked meat-fed cats. Decrease in visceral volume, evidence in the diminishing size of their thorax and abdominal cavities. Frank infections of the bone appear. By the time the third deficient generation is born, they're so physiologically bankrupt that none survive past the 6th month of life, thereby terminating the strain. Microscopic sections of the lungs, second, third generation deficient cats show abnormal respiratory tissues. Lungs show hyperemia, some edema, partial atelectasis, while the most deficient show bronchitis, pneumonitis. In several cases, a hypothyroid condition exists. Thyroid gland showing scanty colloid, small acini, again not observable in raw meat-fed cats. Cooked meat-fed cats show much more irritability. Some females are even dangerous to handle. Three are named tiger, cobra, and rattlesnake because of their proclivity for biting and scratching. Males, on the other hand, are more docile, often to the point of being unaggressive. Their sex interest is slack or perverted. In essence, there is evidence of a role reversal, with female cats becoming the aggressors, male becoming passive, as well as evidence of increasing abnormal activities between the same sexes. Such sexual deviations are not observed in the raw food cats. Vermin and intestinal parasites abound. Skin lesions and allergies appear frequently and are progressively worse from one generation to the next. Pneumonia, empyema are among the principal causes of death in adult cats, while diarrhea followed by pneumonia takes a heavy toll on the kittens. On autopsy, cooked meat-fed females frequently present ovarian atrophy, uterine congestion. Males often show failure in the development of active spermatogenesis. Abortion in pregnant females is common, running about 25%. The first deficient generation to about 70% in the second. Deliveries are generally difficult, with many females dying in labor. And on and on and on. Exhaustion. Regenerating cats. It requires approximately 4 generations for either order to regenerate to a state of normal health. However, because of lack of reproductive efficiency, very few deficient animals regain the normal health noted before deficiency was imposed by their line of cats. The third generation skeletal soft tissue changes are still noticeable, but to a less degree. By the fourth, most of the severe deficiency signs and symptoms disappear, but seldom completely. One of the experiment's more startling discoveries is that once a female cat is subjected to a deficient diet for a period of 12 to 18 months, her reproductive efficiency is so reduced that she is never again able to give birth to normal kittens. Even after 3 or 4 years of eating optimum diet, her kittens still show signs of deficiency in skeletal and dental development. When her kittens are maintained on an optimum diet, a gradual reversal and regeneration takes place. So basically, over a period of generations, and even within a generation, you can alter genetics by going to greatly raw food. It shows over and over again in the literature here. You have resistance to disease, and it goes on and on here. Underbites and overbites, dentition, delay in deciduous teeth, bleeding gums, runny noses, fevers. Allergies and thyroid deficiency Normal cats on a raw food cod liver oil diet show no evidence of allergy or hypothyroidism. And their offspring, generation after generation, show no evidence of either. Allergies. Giving cats cooked meat and milk, they develop all kinds of allergies. They sneeze, wheeze, and scratch. Irritable, nervous, do not purr. First deficient generation of allergic cats produce second generation kittens with greater incidence of allergies. By the third generation, it's almost 100%. When second generation animals are bred after being returned to an optimal raw food diet, their allergic symptoms begin to diminish. By the fourth generation, some cats show no evidences of allergy. When milk is removed from the cat's diet, the allergic symptoms immediately clears, revealing its specific allergens. Milk allergies prove common among second and third generation deficient cats, their regeneration counterparts. They often develop asthma. And this is found in humans, as we talked about before. So here it's going through the bowed legs, abscesses, abnormal urine. So basically this goes back to what all those other studies are saying too. You got to get back to a more conservative diet, mostly raw. Get away from processed foods. Your body does better. Simple as that. Low carb, high fat diets. Here is one exception. When I have somebody with epileptic seizures, we have a specific procedure that we do as outlined in part 1. We also put them on a low carb, high fat diet, and we can usually get someone not to have repeated seizures. We show you how to stop seizures in process in 15 seconds also. (11D) high carb diet. This is, you've all heard about the Mediterranean diet. Basically it's high carb. What we hear about the Mediterranean diet is not what we're normally being told. When they get baked goods, they go to the bakery every day. They don't get some bread and let it sit around for a week. They go and get newly cooked bread every day. They don't let stuff sit around. It's high amount of raw diet. It's not what we're being told about. What about mood? High carbohydrate and mood. Mood improves on low fat but not low carb diet. So you want high complex carbohydrate, low cooked fat diet. This is Archives of Internal Medicine, Journal of American Medical Association. Grapefruit is not alone in interfering with meds. Research seeks new options. Here are some other things other than what we went over with the furocoumarins. Okay, 11G. Okay, here is garlic. If you have somebody that's having all sorts of trouble with infections, of course we already talked about green leafy vegetables. When Great Britain went into World War I, this is long before antibacterials were introduced like penicillin. That was introduced pretty much after World War II. In World War I, the British government bought up all the garlic that they could obtain, and thousands of tons were purchased for treating wounds of injured soldiers to prevent infection. From the thousands of wounded treated with garlic, not one case of septic poisoning was produced. So basically you have people with that are having repeated infections, get them on a high raw food diet, get them on green leafy vegetables, give them garlic. If they just put them on garlic. If they have infections all over their body, put them on garlic, like a level teaspoon of minced garlic. Have them chew it up real thoroughly. Have them take maybe 2 or 3 or 4 or 5 even teaspoons a day, and it will kill that infection just pretty quick. If they have an infection of the throat, when somebody has an infection of the throat, right at the first tickle or itch or scratch that they feel, have them take down a teaspoon to a tablespoon of apple cider vinegar. That'll kill it before it goes anywhere. Or you can have them gargle with 50-50 solution of vinegar. I've had people, they say, oh, I can't stand vinegar, what about pickle juice? I said, try it. They find that sipping pickle juice does about the same. Now, if it's really, really, you got a deep infection there, get powdered garlic out of your herb cabinet, take a half teaspoon, just swallow it dry. It'll cling to that infection in the back of the throat, and it will kill that infection, okay? Now, we talked about stones, and this could be stones in the pancreas, in the gallbladder, or in the kidneys. Gravel root, also called queen of the meadow. Hydrangea, okay? That will break up those stones, right? So that's another way to approach that when the stone is actually calcified. Okay, some people ask, well, what do I think of when, in my mind, when I go through allergies, hypersensitive, and intolerances? This is what I go through. So you have that in number 12. 12B is the difference between intolerance and food allergy. Well, they're basically just different manifestations, one more serious. 12D here is diet crime and delinquency. And latent scientific studies confirm food allergy behavior link. Patients report significantly more nervous system complaints, cognitive, emotional symptoms when exposed to allergens than the placebo solutions. Patient complaints included depression, inability to concentrate, anger, irritability, and headaches. Other researchers suggested that stealing and violence might be food allergy reactions. Richard McCarness treated a woman in England who had been hospitalized 13 times for violent behavior and depression. She would demonstrate her anxieties by slashing her arm. On one occasion, she'd thrown her daughter out of the house through a closed window, knocked her 3.5-year-old son unconscious. She was recommended for lobotomy, surgical procedure on the brain. After being placed on a restricted diet, she became content, found employment, was no longer violent. Charles T. McGee, a California physician, has documented numerous children responding adversely to foods and other substances. In his book, How to Survive Modern Technology, he describes in detail case after case of children reacting to such substances as corn, cigarette smoke, chlorine, or plastics. Using a number of tests to determine adverse reactions, Dr. McGee has found that most reactions to foods and chemicals are subtle. He's observed reactions occurring at any time from a few minutes to 72 hours following exposure. That's 3 days. I'm going to add one more day to that. So when I put somebody on a elimination diet and I say, okay, I want you to go back on one food at a time to see how you react to them. And if you don't have a reaction, put it on a good food here. So you're piling up the foods that you can eat. If you react at all, and it could be just from inhaling it. For example, in books on allergy, we find that inhaling cod vapors, such as from fish and chips, can set people off. I had people who, when chicken was under them, their nose started to itch, and that person was me. And I noticed I read about chicken versus beef, and I thought, well, I'm going to get on nothing but chicken, for a period of time. I got on chicken alone for animal protein. I gained 40 pounds in 30 days. I thought, oh my Lord. I thought, what am I doing here? And then I thought, that only happened after I went on chicken. So I got off of chicken, and I lost 40 pounds in 30 days. It was causing a histamine reaction. My body was retaining fluid. It was just as simple as that. It can be that easy, folks. And so basically when you put people on these foods, you tell them, see if you have any type of adverse reaction whatsoever within 4 days. If you do, then assume it's that food, put it over here. I've gotten people off of allergy shots that they were getting a weekly allergy shot for 28 and a half years, another one 23 and a half years, another one 17 and a half years by doing things just like I'm describing. We put them on distilled water only for fluids, get them off of milk and grains, get them off of animal protein, get them off of eggs and chicken, and we do this for maybe 3 months, and then we start adding in one at a time, one food at a time every 4 days, and see if they react to it or not, okay? And I gave you the for instance of the guy whose throat swelled up when he went on apples and melons. I had another guy who came in every time he went out in the cold air, his throat swelled up. And basically he owned a dairy. I got him off of milk products and it quit. He said, just don't tell anybody. I've seen that with people who raise wheat. There's a peanut farmer's disease. They get allergic to peanuts, from overexposure. So you see all sorts of things with this. And people may say, well, I've never been allergic to that stuff before. Well, maybe not, but your body's ability to withstand it breaks down over a period of time. And that doesn't mean that you can never have it again. I find that when people are pretty much totally off of substances for maybe 2, 3, 4 years, maybe they can tolerate it a little bit at a time, but they can't go at the rate that they used to have it. Now here we have at 79, woman came in, chronic depression. Isolating a number of foods she was reacting to, eliminated them, her condition improved markedly for the first time in years, as evidenced by her energetic and jovial disposition. And she had pronounced behavioral changes, and they call it unmasked food sensitization. Some producing, marked food allergies or food addictions become related to these foods commonly eaten and producing some adverse reaction when withdrawn. So basically when you take somebody off the food, they start detoxifying, they feel worse. So they go back on it, they feel better. Well, let them detoxify and get it out of their system. You have a non-inflammatory swelling of the brain which can trigger aggressions. Allergies are almost never seen in people living in a primitive lifestyle, eating a natural diet. This is Dr. Price, remember Price Pottinger? Where do we get it from? White bread, lots of processed milk, canned food, no vegetables. Gets sick when he eats chocolate, candy, cookies, soda, etc., etc. Feels better after he stops eating candy for many days. People develop allergies to the foods they consume the most frequently. You are allergic to what you are addicted to. People crave these foods, frequently turn off symptoms by eating them, just like we talked about up over here. How can you tell if somebody's allergic just by looking at them? Dark circles under the eyes, pale complexion, poor concentration, postnasal drip, running nose, fatigue, insomnia, headaches. Here's somebody who had markedly elevated aluminum level related to certain seizure disorders. Basically aluminum cookware, deodorants, soda cans, beer cans. Yeah, they're coated, but when you take the pop top off, they're still getting aluminum right there. Not only deodorants, but antiperspirants, okay? What they're not mentioning here is that it happens in most calcium supplements, high in lead, aluminum, cadmium, and copper. Dairy products. Diet revealed a high consumption of milk. Milk allergy. After removing him from all dairy products, for 2 weeks he was seizure free. That time he consumed 1.5 gallons of milk, had 4 seizures. Then he became convinced that milk triggered his seizures. He stopped all dairy products. This reduced him quite seriously. Over several weeks, her violence and seizures subsided until she was able to function completely without medication. A bad child is often a sick child. This is clinical ecology. Jeffrey Bland, biochemist at the University of Puget Sound in Tacoma, a dietary intake of 30 chronic juvenile offenders. One group of youths was constantly in trouble with the law and the other was not. And he got it down to basically milk consumption. And hyperactive children, took them off of milk, all reported markedly positive improvements when milk was completely eliminated from the diet. 5th child reported moderately positive results. So, reported that March 81 Journal of Behavioral Ecology by the Law Enforcement Assisted Administration, U.S. Department of Justice, corroborates our discovered concern for milk consumption. Nearly 90% of the offenders had a symptom history associated with milk intolerance or allergy. B1 deficiency in hostile youths. Alcoholism, addiction, and diet. Roger Williams, PhD. We're going to talk about, maintains that no one who follows good nutritional practices will ever become an alcoholic. Heroin methadone diet. Points out that addiction functions in artificially induced drive both in its psychological, physiological aspects. William H. Philpott, Oklahoma City psychiatrist, agrees. And basically, they started giving nutrients to withdraw people off of alcohol and drugs and et cetera, and they were they had a loss of craving with it. And I would suggest that you get this book. It's very, very good reading. If substance abusers followed the recommended diet, they would generally quit all substance abuse. That speaks for itself. Pulse test. So, Arthur F. Coca, MD. This is really interesting reading. Had a patient come in, and she noticed that when she ate a certain food, her heart just raced and pounded. So he had her start keeping, and he started noticing that people who had allergies, their heart would race. Now he goes through a whole lot of stuff here, which I think hardly anybody would follow. He even says if your heart rate is even 2 beats above normal, you could have a really bad allergy. Well, it's so complex in how he's showing people how to do it. I just basically ask people, do you notice that when you eat certain foods that your heart races or pounds? And they can usually just tell me right off, and I say, get off of it, you're allergic to it. And that'll solve a whole lot of allergy problems. So that's a quick way to do it. 12G, medical botany. Now, if you can get a hold of a copy of this, I would suggest that you do. This is very important in my opinion. And basically, again, I'm going to say this doesn't apply to everybody. It's only certain susceptible people. But if you suspect it with someone, then you jump on it like this. Danger of chamomile tea. That's in so many herbals right now. Helps people relax and go to sleep. Not only is it freestanding tea, but it's in several of them. But basically, danger of chamomile tea ingestion by an individual known to have ragweed allergies and chrysanthemum allergies. So chamomile tea, woman developed abdominal cramps, thickness of the tongue, tight sensation in the throat, followed by angioedema of the lips, diffuse pruritus, full sensation in the ears. No vomiting, diarrhea, wheezing. Unfortunately, some stuff was administered. Look, it can be anaphylactic. So when I have somebody come in and they say that they have allergies, one of the first things I ask them is, Do you drink herbal teas? Well, yeah. Do you drink chamomile? Yeah, it helps me sleep. Get off of it. Super amount of people that are on chamomile tea or have chamomile is, one of the ingredients. They get off of it, and lo and behold, all of their allergies go away. Just as easy as that, folks. Just as easy as that. And I want you to start thinking that way, okay? Now, here's aeroallergens causing allergic rhinitis, bronchial asthma, hypersensitivity, pneumonitis. Now look at this, chlorella. We're told it's the perfect food. It's got all the minerals, trace minerals, all the amino acids in it, all that good stuff. It's one of the most allergic plants out there, folks. We're being sold this, we give it to our patients, trusting them. We don't even look at it like this, but look at all this stuff that it can do. And we're told about mildew and yeast and stuff like that. False yeast, candida. You know that candida is a false yeast. It's actually a fungus. It's not a true yeast. Ginkgo biloba. Oh my gosh, this is in so many herbal things, especially for circulation to the brain. I had my wife come in one day and she said, I just haven't had any energy for the last 2 weeks. And I said, well, did you start 2 weeks ago? She said, well, I thought it'd be good if I get a multivitamin. So I went and got one. I'm thinking, here I am, I have all sorts of nutritional degrees. She doesn't even ask me. I said, go and get it. Last ingredient was ginkgo biloba. I said, just go get anything without the ginkgo and you're fine. She got rid of the ginkgo and her energy came back immediately. Folks, it can be just as simple as that, but you gotta know it first to look for it. Amaranth, one of the ancient grains, supposed to be all this good ancient grains for you. Wow. Okay. Carrots. Ooh, boy. How about that? That's right up there with ragweed. Dandelion, hazelnut, filberts, mustard. Mustard's in there? Yep. Hemp. People ask me, do you have any issues, with the hemp oils? I'm going, well, I might, because I know about this, okay? It may not have any of the hallucinogens or any of that stuff in it, but a certain number of people are allergic to it, and it's going to cause a problem. Hops. Hops is in beer. It's in several herbal teas that help you relax. Yeah, it can cause problems. Papaya, it's in digestive enzymes. Somebody who's taken a digestive enzyme, look what can it cause again? Allergic rhinitis, bronchial asthma, hypersensitive pneumonitis. Sugar beets, we're going to see sugar cane also in here in a little bit. Sage, it's right in your herbal cabinet that you cook with. Peas, yeah, peas by themselves can cause problems with people. Mesquite, I had people who every time they went to a mesquite grill they got sick. I knew about this. I said they use mesquite in cooking. Guess what else mesquite's on? Okay, it's also called creosote. It's the stuff on the phone poles. You go up and you put your hand on the phone pole and you're allergic to it, guess what? There it is. Or maybe even you get, in close proximity to it. Gum, yeah, some people have trouble with just gum. Walnuts, hickory, pecan, butternut, walnut, mints. Yeah, people who have mint gum or have mint candies, yeah, that can cause a problem. Myrtles are all green plants. How about that? Olives, oh, gosh, I didn't know people were allergic to olives, but there it is right there. And yeah, you may have to take some of these people off of olives. Plantain, rhubarb, buckwheat, willow, yeah, white willow, how about that? Aspirin, mullein. Now mullein, I got a comment on. I told you we were going to get to this. Now, that is an expectorant. When you have somebody that has congestion in the chest, you want to give them lobelia, which is an expectorant, and mullein, which is an expectorant. Now, I had a lady with cutting horses. The cutting horse was coughing continually. And she said, do you know anything to do? What the vet's doing is not working. I said, well, go get some bulk mullein, put 4 ounces in the food every time you feed them. In about a week, 2 weeks, all the coughing was gone because it got the phlegm out of the lungs. So if you have, any type of stuff in the lungs, this can help. My father had, he smoked for 60 years. And he only had 15, that's 15% lung capacity. Well, his lungs filled up with fluid, and he was so bad that the hospital called us, said, hey, you better get down here, he's going to die before the weekend's over. And so I called all my kids, said to pull the kids out of school, get them there. I called my sister, told her to call her kids and get down. He was in the hospital in Tulsa, and I was like second or third person there. Every time somebody got there, he cried, and he got stronger. This shows how much of a mental thing health can be in a hospital. There was a study that was done on nurses in hospitals. They said, can you predict with relative a surety when somebody goes into hospital if they're going to come out alive or not? They said, oh yeah, 95% by their attitude. Do they think they're going to get out, or do they want to get out or not? Okay, my dad survived. Now that hospital got all the lobes except one out of the fluid was out of it. They couldn't get it out, so they asked me what to do. I had my mom get some mullein and lobelia, have her give that to him. Within a couple of weeks, all the rest was taken out of there. So when I have people with lung congestion, I always give them mullein and lobelia to get it out. Now my sister, she called me up one day and she said she had had double pneumonia and was coughing really bad for 4 months, and she said nothing was helping it. Did I have anything for it? I said, yeah. You have a small pot or a tea kettle? She said, yeah. I said, fill it up halfway with distilled water, put 2 tablespoons of apple cider vinegar in it, and the 2 tablespoons of apple cider vinegar in it, and bring it to a boil or whistle. Stand about 1.5 feet away so you don't get scalded. Inhale the vapors 5 minutes 3 times a day. 4 days she was out of it. Now a couple of things that cider vinegar does is you inhale it, it cuts through the mucus. Now the pneumonia virus, pneumococcal pneumonia, sits up on that mucus to where the drugs cannot get to the bacteria. Well, it also provides an unfavorable environment for the bacteria, and she basically got over it in 4 days. And I've taken several people with pneumonia, and that got them right through it very quickly, just like that. And we're going to talk more about cider vinegar a little bit later. Look at this, hackberry, elm, there are all sorts of trees here. And some people may have to get in a neighborhood where they don't have that certain type of tree. Grass. Some people may be allergic to a certain grain, or some people may be allergic in general to the grass family. For example, if they go out and cut grass, they have to wear a dust mask. You can probably bet that they are allergic to all grains. That's going to be very few, but there are going to be a few of them, okay? That's one way to identify it. Palm, you have palm oils, palm trees. Oats, Bermuda grass, crabgrass, fescue grass, sorghum, rye, corn. Okay, these are things that can cause these particular issues. So you have to be on alert about these things. And just go through that list with people when they come in with those things that nobody's been helping them. But you're going to find it, and you're just going to remove it from the diet, get them away from the source, and they will clear up doing nothing else. But you have to be able to identify it. That's why this is so important. Here's sugar cane. Hypersensitivity, pneumonitis, sugar cane. So you may have trouble with either beet cane or sugar cane, and you have to be able to look at it. Higher plants of allergic significance in the continental United States. Maple. So you have maple trees, maple syrup, okay? And you have oaks and mulberries, different types of trees here. Pecans, that includes eating those. Oats, rye, walnuts, olives there again, amaranth there again. So those become important there. Look at this. Another Ig-mediated type 1 diseases, coffee bean and castor bean, characterized by rhinitis, asthma, dermatitis. So you may have to get down on somebody and tell them they have to get off of coffee if they are having any of these things. Some people are going to have, in general, allergies to all citrus, including citric acids, which is a preservative in boxed foods. And you have to look out for that. Photodermatitis. Remember the furocoumarins we mentioned that in? There it is here again. People who weren't having problems with sunburn, all of a sudden they start getting sunburns, maybe because they're eating a lot of furocoumarins. Irritant mustard oil right here in the Brassica family. Higher plants that provoke photodermatitis in man. So here again, people that are having trouble with the sun or maybe light and they have to wear shades all the time, okay? Dill, are they eating a lot of pickles? They like pickles. Celery, carrots, they put these, they've read about them, they have them, daily in their salads. Fennel, a lot of people use that for their lungs. St. John's wort, antidepressant. A lot of these people who are on St. John's wort are having photodermatitis from that. There's mustard again, the brassica, figs, lime, sour orange, rue, oats, sorghum, and legumes. Just need to be very conscious of this, and when you see it, just have your mind go directly to this. It's more to get the person away from those foods, maybe away from those plants, rather than giving them something. Plants primarily responsible for irritant dermatitis. Let's see here. Brassica, there we go again, the cabbage family, mustard family, crucifers, which includes all those things that we talked about. Here's pineapple, papaya, latex. You probably heard about the latex, but not these other ones. Liliaceae in general. Garlic. My first encounter with garlic was when I first went to look for my first practice area in the city I was going to. An older gentleman who is a broker, he said, I'll take you around and show you everything. And I said, fine. So we looked around at different places for several days. And he said, why don't you just stay with me? It'll save you a motel. I said, okay, fine. So he fed me the night before. We get up the next morning and he said, did you hear me up throwing up last night? I said, no. He said, well, that only happens when I eat garlic. And I couldn't remember having garlic. So we had a rye bread, so he went and looked on there, and sure enough, the last ingredient was garlic. He had such an allergy that it made him throw up like that. So it can be just minimal amounts of something, just like that, that can cause a problem. Okay, plants causing contact dermatitis from volatile essential oils. Hops again. What? Beer. And herbs that have it in it. Dill. Dill again. Celery. Caraway. Bitter orange, lemon, lime. Oh my gosh, people who have lemon in their tea or their water all the time when they eat out, they don't even realize that it's causing dermatitis. Spearmint, cinnamon. Spearmint, I had a patient that heard that mints help digestion, so she had a cup of mint tea once or twice a day. Well, she ended up getting bleeding ulcers out of it. Now, we got the bleeding ulcers down, but I had to get her off of the mint tea because that's actually what caused it. It was causing the body to over-secrete stomach acids. Camphor, feverfew that we give for headaches can cause it. There's spearmint. There's fennel again. Sassafras, like sassafras tea. Thymol, thyme. And your herbal cabinets. Melaleuca, which is tea tree oil. When they first came out with that in the 1980s, everybody thought, oh, here's a cure-all. I didn't have a lot of problem with it at the start. Then they started putting it in the hand soaps and detergents to wash the clothes in. I thought, I'm going to have people start coming in with all sorts of skin problems, and they did. When they did, I said, you're a Melaleuca representative, aren't you? How did you know? I had to explain this to them. I had to open this book and show them. Rosemary oil. Here's chamomile again. Burdock is in a whole lot of herbs. Artichoke. Primrose oil. Yeah, the stuff that we give people, for the gamma-linolenic acid. That's right. Cashews. Mango. Cayenne pepper. Capsicum. Remember we talked about that before. Mango again. Vanilla. How many things have vanilla in it? Yeah, we may have to get people off vanilla for this stuff. Cinnamon again. Sweet gum. Yeah, gum. Chewing gum. So I want you to be acutely aware of this for those conditions, and when it comes up, bring it up to the patient. It's not just giving stuff to people. You got to nail what's causing the thing, and I'm presenting to you a lot of causes of those very substances. Those symptoms. Okay, here's something from the Journal of Toxicology, 1997. Bromism from excessive cola consumption. University of California, Davis Medical Center. Now, here's a patient presented with headache, fatigue, having trouble walking, memory loss, and progressed over 30 days. And he consumed 2 to 4 liters of cola. That's a half gallon to a gallon of cola, basically, containing brominated vegetable oil on a daily basis before presenting with these symptoms. His right eyelid was drooping. He got to where he was no longer able to walk. They had to use hemodialysis. Substantially cleared his condition. Now, this is another example of why I take people off far more things than I put them on, because of things like this. You need to familiarize yourself with some of these symptoms. When people come up with them, immediately think, cola. How much cola do you drink? How much soda do you drink? Here's a patient of mine presented. He was 17 or 18. He was a senior in high school. His mother brought him in. He was the top keeper, what you call goalkeeper in soccer in Metroplex Special Leagues. And he came down with mononucleosis, positive monospot test. And basically, the MD told him, you're going to have to lay out for 9 to 12 months. And you tell this to a senior in high school, it's like, oh my gosh, you know, it's the last year I'll be playing in high school. Can't do that. So she brought him in to me a week later, and we swiped his tonsils as we teach in part 2, and we also told him to take 5 grams of vitamin C 5 times a day and a tablespoon of colloidal silver, the type that I recommend, 5 times a day. I don't recommend all types of colloidal silver, only one type. And you need to know what that type is, you can email me at drbbRk@hotmail.com and I'll tell that to you. So, he was diagnosed 1 week before he came in. You can see that 3/17/04. And a week afterwards, 3/31, tested negative. So basically, we did the nutritional things that I just said, and we did 1 swab the back of his throat on the tonsils as we teach in part 2, and he came out good. Now, who's ever done this before? You ever seen this before? It's easy to do, you just got to know what to do. So basically, we built the body's immune system up. We also told him to go on distilled water, by the way, and totally get off animal protein and grains. So we put him on a high alkaline diet. But it only took a week, okay? Basically, the colloidal silver kept the virus from replicating. It gets into the replication of pathological organisms and keeps them from replicating without hurting the host. As soon as he was off of it, I told him just keep on taking it for about 2 weeks, then get off of it. You need to have people take stuff for 2 to 3 weeks after all the symptoms are gone to get rid of any residual that may be subclinical. (13B) How do you get somebody to quit smoking? Well, there are some acupuncture things, but basically put them on an alkaline diet. It's been known for a long time. High alkaline diet, look at that, Stanley Schlatter, PhD. Minimize withdrawal symptoms, maximize the ability to stay free of nicotine. 82% who'd failed were acidic. Very simple to do. You can stop the cravings like right now. Another way to speed it up is to have them take a 1/4 to 1/2 teaspoon of baking soda with each meal. That speeds up neutralizing those acids. And you keep on doing it? No. If you remember from B12, you don't want to destroy the B12 in your body. Here we're just speeding up the natural neutralization of excess acids in the system. 13D, allergy tests. So here we have food allergies and adverse reactions. Judy Perkins. What value are the tests? Unproven, unapproved allergy tests used in the diagnosis of suspected food allergy. Basically what they're saying here, all of these so-called allergy tests can be classified as unproven, unapproved. None of them has satisfied a proper evaluation trial to be acceptable as safe and efficacious. And, you know, there's a whole bunch of them, virtually everything. And so I do not trust tests in this regard. The only way that I trust is to get someone off of all animal proteins and grains, eggs, chicken proteins, citrus for about 3 months, dairy proteins or dairy foods, and put them back in at 1 every 4 days. If they have any type of adverse symptoms at all in that 4 days, put it on a don't eat list. If they sail through it, nothing's problem at all, put it on an okay list. And you're going to find people who haven't been able to tolerate hardly anything. You're going to find maybe 2 or 3 foods that's actually hypersensitizing them to about everything that they're having trouble eating or drinking. Once you get those out of the diet, then their body starts to build up. And even those things, after a period of time, maybe 2 or 3 years of pretty total abstinence, then their body can tolerate it somewhat. But you got to tell them, you can't have near as much as you used to have. And that is the best way to do it. Here it says 72 hours. I've found in, like I said, 4 days. That's 3 days. Here we have mold, dietary mold avoidance. Basically what this is you get fresh food, you cook it, keep it maybe 24 hours. If you haven't ingested in that time, throw it away. It's got too much mold in it. Yeah, it's right in the literature. We don't follow that at all. So people are eating stale food and food that has mold on it, and it's causing a lot of problems. We don't even recognize it. This is one of the benefits of the Mediterranean diet as it is in the old country over there. They get fresh food every day. Baked fresh bread, they don't keep it around. They eat it fresh and it's gone in 24 hours. Then they go back to the store again, get it fresh again. Here's clinical ecology practitioners. I've had some people that were going to them, and basically clinical psychologists tend to over-exaggerate problems. I've had people get extremely angry with them because they took them off about everything that they could have and totally ruined their lives. And maybe there are a few cases of that. I've seen too many go through that way, and it wasn't necessary whatsoever. And I started inching them back into society, and they started finding out that they weren't reacting as heavily as the clinical psychologist had told them, and it caused them severe mental distress. So you got to watch out for that. 13E. Patient brought this in to me. Basically GMOs type of issues here. They fed GMOs to pigs and they started bleeding out the bowels. So it can cause an inflammation in the gut. So this particular patient had a brother that this was happening to. They got him off of GMOs and the bleeding from the bowels stopped. So that's another thing to look for. Right, here's a patient that came in with fatty liver and atherosclerosis. This was taken 5/13/2016. And see, fatty liver, atherosclerosis of the abdominal aorta. And she went for 2 years, didn't do anything about it, didn't take any drugs, did not alter the diet, and then she started reading about how fatty liver can cause scarring of the liver and maybe later on liver cancer. And that was an imaging. And this was taken 3 weeks after she came in to me. And we're going to show you some other things. Keep in mind she'd taken no drugs, done nothing with her diet whatsoever. And this was 3 weeks after what she came in to me for with that. Now, what did she have? This was taken on fatty liver. Abnormal lab results are elevated ALT and AST. And so this patient comes in, she had this metabolic panel 1115 of 18, and it showed high ALT and AST. There's also low carbon dioxide, elevated potassium, and protein. So she comes in to see me a week after this because she had had those other imaging tests done 2 years before, and she was about to get another one. And so fatty liver lecithin cures fatty liver. So we had her go on lecithin, sunflower lecithin, and we told her to get off all animal protein and grains, basically eat fresh raw fruits and vegetables immediately after that. So she did that for 3 weeks, and she had that clear imaging test. Guess what? 3 weeks later, 1119 of 18, ALT, AST, protein, all of it was resolved. Your body responds miraculously when you put it in the right position to do so. Now here is a patient who's basically very depleted. Female, I turned 26, my body decided to completely rebel. I was confused, frustrated, entered almost every day with feeling my body was ripping itself apart inside. Hopelessness started to set in as it seemed like every time I ate would send my body into an inflamed, pain-filled nightmare. Just never seemed to end. Lost about 40 pounds. Now she started at 113 on a 5'2" frame. Came into me, she was 65 pounds. Now she was not anorexic. I want to emphasize this. My body was deteriorating in front of me. Her husband, her in-laws, thought, well, she's going to die if we don't do something. Now they become patients. She came in, I was in constant pain, been to numerous doctors, to no help or avail. My husband had been to Dr. Bonebreak for his chiropractic abilities, quickly noticed his extensive expertise in an array of other areas. We finally decided I should consult with him. Turns out that decision was one of the best of my whole life. Not only did he help me alleviate my pain almost immediately, he guided me through the entire process of healing, which is not an easy task, saved me in multiple ways, including correcting my body back to normal. I'm forever grateful. Now, we did a lot of neurological things on her with treatment, and she gained back up to the low 80s, and we changed her diet around. It wasn't coming as quickly as I thought it should, and I started asking her a lot of questions, and it turned out that she had had some blood sugar fluctuations. So I had her go to the health food store and get some betaine hydrochloric acid and start to take that with each meal. And as you remember, that's one of the things that helps the blood sugar in certain individuals. And she started just consistently gaining weight. Now she's back up to 113. Everything is going well. So you can take care of these people who are basically on the verge of death. Okay, here's several patient case histories that may be of interest to you. He was around poison ivy all his life, never reacted to it. Suddenly, every time he went to the family farm, he did it for several years. Only topical prescription cortisone could do it. So basically, he just out of the blue just started reacting. Only topical prescription cortisone would get rid of the reaction, or his arms and face would swell up like a balloon. Diet history found nothing out of the ordinary. Asked if he ate or drank anything different at the time. He started ingesting a certain food at a restaurant along the way that he hadn't prior to being afflicted. I said to just avoid that, and that was ice cream, by the way. Avoid the milk products, see what happened. No more reactions to the poison ivy. Since then, I've had several patients comment on reaction to poison ivy, found they ingested the same food, and that is milk products. So I recommended abstaining. Every one of them quit reacting as well. Now, if somebody has taken cortisone, I'm going to tell you there's a homeopathic called Rus-Tox, R-U-S-T-O-X, and the Rus-Tox will help resolve the poison ivy if you haven't had cortisone. Now, if you have had cortisone, then it won't work. So it's got to be one or the other. She was in her late 20s, had 3 children, had severe non-responsive cellulitis in her legs for the past few years. Her legs have been swollen, red, didn't respond to antibiotics or any other remedy. I had her apply certain hot apple cider vinegar to the affected areas 10 minutes twice per day for 3 weeks. So basically a cotton towel in hot apple cider vinegar, have her put on the compress. All the redness and swelling completely subsiding along with the pain. So you can take care of cellulitis. We've had this done on many individuals, including my sister who came down with it. So hot apple cider vinegar compresses in cotton towels. Apply it for 10 minutes 2 or 3 times a day, and the cellulitis will resolve, and it's very good. And she was a wealthy real estate broker. She was in her late 50s, had pale skin with many hard crusties all over the skin on her back, like a lot of older individuals have. She tried every remedy to no avail, no medications help. I evaluated her diet, found that she was exemplary in quality, and ate a lot of fresh fruits and vegetables, drank only quality beverages. On further questioning, she said she had added oil to her bath water, used soap, and didn't eat seeds or peels of foods. I explained why her skin was reacting the way it was in response to doing what she was, and had her stop adding the bath water oils. So basically, when you use soap on your body, it takes the oils out, and you're saying, I don't want oil here. When you put oils on your skin, you're saying, I don't need oils. You're not ingesting them in the way of the seeds. And the peels are a lot just like our skin, also in that they have organic silica in it. So I had her take the oils out of her bath water, quit putting it on her skin. I had her use non-soap cleansers, which are surfactants, and had her start ingesting the full food. So you cut the peels very thinly, and they don't taste too bad that way. You chew the seeds up. Then I also had her apply a certain brand of aloe vera barbadensis Miller. I only recommend this one brand. You want to know what it is, just send me an email, drbbrk@hotmail.com. Within 2 weeks, she said her friends were commenting on her facial skin, asking, who are you going to? What kind of, you have a new dermatologist. The hard crusties fell off her skin in just a few more weeks. So basically it changed the whole way she was looking. The boyfriend of my employee managed the local Hilton Inn high-rise hotel. She was a former emergency medical technician. She came to me one day and said he'd been flat on his back for 3 weeks with a fever of 102 to 104 degrees, could only sleep 2 hours per night, been on a high dose of antibiotics prescribed by his MD with no effect. He normally worked 14 to 16 hours a day, 7 days a week without missing. She changed his diet to what she figured I would have after observing me work with patients for several years, which was generally correct. After hearing all this, I told her to give him vitamin E, 3,000 international units daily for 2 to 3 weeks, then stop. He would probably break out in a heavy sweat and start sleeping well. She gave him the first dose, and within 3 hours he broke out into heavy sweat. The fever broke. He slept heavily for 8 hours, felt great, and went to work. So basically, what I heard was his body wasn't responding to the nutrition. antibiotics weren't working, so I thought things aren't getting in and out of the cell. Now, if you recall, vitamin E is necessary for cell wall flexibility, and when you're lacking in it, it becomes too rigid, and oxygen and nutrients can't get in the cell, waste cannot get out of the cell. So that's why I immediately thought of vitamin E, and it worked very well like that. Again, you can get miraculous results if you just think about it a little bit. So I'm wanting you to get in the rhythm of thinking the way that I think to make these things happen quickly. Now, she'd been to an MD and a radio personality that specialized in systemic Candida albicans, neither of which helped. Both ascribed to the techniques of Dr. Crook, which we went over, the MD who popularized his approach to Candida, which is a high-protein diet, so it won't feed on carbs. Nystatin and ketoconazole, and this is misspelled here, ketoconazole, because of the chemistry involved. I had her completely change the dietary approach to predominantly alkaline foods, plus caprylic acid to break down the shell of the Candida, activated charcoal to absorb the acetaldehyde, and proper probiotics. Just a few weeks she was free of all symptoms for the first time in years. And this was a young woman. She was in her very early 20s. And she had been a top athlete in high school and basically got down to where she could hardly move, had no energy, etc., etc. So we just used what I talked about before for the Candida albicans. She had repeated vaginal yeast infections. And if you remember, the yeast, the Candida, is actually a fungus over several years, and had to repeatedly get drugs to shut them off. I had her douche with distilled water with baking soda, maybe a half teaspoon of baking soda and distilled water rather than vinegar, and the infection ceased. So if you recall, on fungus doesn't like alkaline. I figured a moderate alkaline like baking soda would work here, and it did. So if you have anybody that has repeated yeast infections, have her do the vaginal douche with distilled water and baking soda, and it makes the environment very unfavorable for that fungus. She started having energy depletion and spontaneous nosebleeds. Questioning, I found new drapes and carpet, which are loaded with formaldehydes, were added to her home. She returned them, put the old ones back, and she normalized. So she was reacting to the formaldehydes. You're going to find a lot of people have that, and we're going to see some other ones here. In cabinet making for 20 years, he suddenly began having nosebleeds anytime he went to his work environment. Formaldehyde in particle board and plywood. Even when around objects with formaldehydes at home. The only thing that could be done was to change professions because of a certain acquired chemical sensitivity. Then he normalized. So here's another thing that can cause nosebleeds, and sometimes you just got to get people away from it, and they just can't be in its presence because their body become so sensitized. And that's all you can do for treatment, at least until you get the body totally detoxified, and many times that takes 2 or 3 years to get them to where they can even tolerate it a little bit. She came to me recommended by her chiropractor because he'd broken 3 ribs in an auto accident. Couldn't practice for 2 months while on the mend. After I adjusted her one day, she mentioned that she had 3 to 5 major asthma attacks every day. Usually had one once a month that sent her to the ER, asked if I could help. This had gone on since she was a little girl, and I knew the chiropractor she had been going to was heavily into nutrition, but nothing had helped her with this particular problem. I looked into her eyes with magnifying glass with attached light. Her eyes were dark brown throughout, but I noticed a very small, insignificant patch of blue that couldn't be seen with the magnifier. Based on this, I recommended dietary changes, avoiding milk products, eggs, and grains, and taking extract of lobelia. Now, extract of lobelia is specific for asthma. Every time she took the extract, within a few minutes, she would cough up volumes of mucus, and I had her take this under the tongue, by the way. Within just a few weeks, her attacks diminished significantly in number and intensity, and the attacks never sent her to the ER again. In fact, she got to the point where she only had one minor attack per month, and a year and a half later, her eyes were bright blue with not a hint of brown in those. And basically, I took several courses in iridology, and that's where I learned about looking in the eyes like that. He was an engineer with Boeing who came up with the idea for the 777. He brought his wife after hearing me on the radio, and she'd been wheelchair bound for 17 years with multiple sclerosis. Her voice was unintelligible squeaks. She couldn't feed herself because her one usable arm shook so hard, and she was on a catheter because she couldn't control her urination. I had him change her diet to drinking and cooking with distilled water only, avoiding milk products, eggs, and grains, along with other physical treatment. 2 weeks into the treatment, he came in with a urine bag and showed it to me. It was completely full of mucus except for a small amount of urine at the top of the bag, just a hint. He said he woke up to this every morning since the start of the treatment and wondered what it meant and how in the world that much mucus came out of the small urethral opening. I said she was detoxifying and it came out in small bits, and he said that's what he figured. Within 3 months she was speaking intelligibly. I met her sister in a restaurant in Scotland about 6 months after starting treatments. She said she couldn't understand her for 3 years previous to that. They made me an honorary family member, and eventually became totally normal. The good arm quit shaking, and she could feed herself within 6 months. In a year and a half, she was able to start standing with almost 19 years, with help, almost 19 years after being wheelchair bound. And you can do just miraculous things. I mean, this person had been this way for a couple of decades. But if you just know the right things to do and progressively take them through it, and they're willing to do what it takes, you can see these miracles happen. The body quits rebelling and starts functioning normally. Her 7-year-old son had daily nosebleeds since he was 7. Questioning revealed he ate a large amount of certain healthy foods. Daily chocolate. They removed it and he normalized in 2 days. Now, whenever I have anybody come in with abnormal bleeding of any kind, I basically ask them, first thing, are you eating chocolate? And the answer is normally, well, yes, I am. I tell them immediately, you need to get off of it right now. And usually in a few days, the bleeding stops. This is if you have bleeding ulcers, bleeding hemorrhoids, bleeding nose, a woman having large and long copious amounts of menstrual bleeding instead of a light to normal 3 or 4 days a month. They may have 8 to 12 days of bleeding and heavy bleeding. Get them off the chocolate. That's usually the answer. He had severe resistant asthma of several years duration. Normal herbs didn't touch it, and I instructed him to make a pint of hot tea made with distilled water with sage and thyme. And he put 2 teaspoons of sage, 2 teaspoons of thyme in it from his herb cabinet, and strained and drank them as hot as possible. Soak in a hot tub of water as hot as possible for 15 minutes, then jump under 5 thick covers and sweat for about an hour. I said he may need to repeat a few times, but no closer than 3 days. You do this and a person gets really exhausted. He improved dramatically each time and all the asthma symptoms disappeared. Now the sage is a diaphoretic, and so you want the hot water. The sage starts the sweating. You get in the hot tub of water, makes you sweat more. You get into the covers, makes you sweat more. Thyme is bacteriostatic, and so basically it helps kill microorganisms. An accountant in his mid-50s had chronic bronchitis, coughing constantly for 9 months, unable to sleep or work well, and as a result, every week, and his weight dropping precariously. He'd been on several rounds of antibiotics to no avail. 5 cups of cranberry juice per day. 4 days later, is cleared up. Cranberry juice is a specific for bronchitis, just in the same way that lobelia is for asthma. She had lifelong hypoglycemia, or low blood sugar, and attempted all the normal high protein diets, which helped a lot. A half teaspoon of brewer's yeast per day and her blood sugar stabilized. Now, if you remember from my master's essay, if you have high or low blood sugar, I immediately get you on brewer's yeast either way, because that's the glucose tolerance factor, and it helps normalize the blood sugar. His blood pressure suddenly shot up 60 points one morning. He came to me that afternoon. After much questioning, a slice of banana bread he just spit off of that morning he hadn't had before was suspect. He avoided it, and his blood pressure slowly went down to normal over a period of about 3 weeks. Now, bananas are loaded with pyramines, and overly ripe fruits and vegetables are even more so. You know, he normally had 2 bananas every morning, or even 3 bananas, but they weren't overripe. And it was the overripeness of this that did it. She had long-standing elevated blood pressure. Normal therapies didn't work. After much questioning, it was being caused by a digestive enzyme supplement containing bromelain from pineapple, which pineapple is loaded with tyramines and can cause problems in certain susceptible people. And she took that with each meal. She got a different one that didn't have the bromelain, and her blood pressure dropped to normal in just a few weeks. So just a hint of certain things in certain susceptible people can cause that. She had long-standing chronic fatigue, tried many things to no avail. A diet history revealed the common herbal tea chamomile she drank daily was the culprit. She discontinued the tea, and her energy returned to normal in a few weeks. A lot of people are totally unaware that chamomile can cause a lot of allergic type of issues, and can even be deadly in somebody that has ragweed type of allergy. It can kill you, can cause anaphylaxis. So chronic fatigue syndrome or allergies, somebody comes in with either one of those, and I notice that they're doing a lot of healthy stuff. I always ask them, are you drinking chamomile tea or something that has chamomile tea in it? A lot of times you just take the chamomile out, and that's all they need to do. They don't need to take anything, do anything special. Just take the chamomile out, and that's it. She had lupus. This happened to be a pharmacist, by the way. I had her take aloe vera barbadensis miller internally and apply it directly to her lesions. The lupus was controlled. The lesions disappeared in just a few months. This remedy for lupus is very well documented by a pharmacist with pre and post pictures, which you see in the documents that we went over. Referred to me by the director of a nutritional medical institute that seen patients from every country in the world. She'd been the head secretary there for 10 years, was cured of a condition by them previous to that. That condition was scurvy, is severe lack of vitamin C. She had chronic fatigue syndrome, heard sounds like she was in a barrel when talking, severe sharp pains in both hips, all for about 3 years. And she also, her brain was in a fog on top of that. The very nutrient vitamin C that had cured her from previous conditions and deficiency was causing her present conditions when she took it in a sustained manner for excess. She dropped back in her daily consumption by 1/3. Her energy came back in about 4 days. The others lasted. After no change in over a month, she cut back a third from her present level of consumption and her hearing normalized. 4 days. Severe hip pain remained. After no change over a month, she cut the remaining consumption by half. After 4 days, the severe hip pain was gone. So taking mega doses of anything for a long period of time can cause problems. And this institute basically went by bowel tolerance, which most people do. Basically, they say take it to a point where you have loose bowels and then back off to where your bowels are normal. A lot of people just like this. It causes depletion, for example, of vitamin E and vitamin A, and then you have all these other symptoms that come up with it.